Hi, everybody. Hello. Can you all hear me? Yep, you can hear me. I hope you can. So, good afternoon or good day to you all. I am having this session. Thank you, Fab. You can hear me good. So, no time to waste time. For those that don't know, my name is Fola, and I am hopefully going to talk about sorry, did I say PhD? I'm always thinking PhD. Sorry, I'm hopefully going to talk about public health and whatever information I hope that you would want to know about public health. So if in case you don't know, or for those that might be wondering, I have a master's in public health and I also have a PhD in public health, and I have been teaching in public health for some time now, both part-time and fully as well. So I think I do know one or two things about public health, and I would like to share that with most of you guys. So I have been receiving a lot of questions around public health, especially those that are trying to get admission, either masters or PhD in that regard. And so I have a lot in my inbox that I don't think I can get through. So I thought to maybe do this session or have this session on public health and address questions, and hopefully that will answer one or two things that you may have as per public health. Now, I have a very brief, what's it called now, outline of what I want to talk about, and I'm just going to sort of like read them out. So I want to talk about what is public health. Hopefully, I hope many of us know what is public health, but I just thought to have a brush on what is public health, who can study public health, um, personal statements around public health, entry requirements, schools that may be offering public health or similar courses, types of public health. So, what are the different main types of public health that we have in terms of specialization or specialty? Master's degree in public health is the MPH. What's the difference between MPH, MSc, MA? For those that might be wondering, which one should I go for? What else do I have? The differences in them, courses or subjects that are covered per term in terms of when you get a public health degree, when you get into a public health program, what are the courses that are covered each term? What kind of subject are you expecting that you would cover as part of your public health degree? Master's degree is what I'm talking about here. Then I'm going to maybe briefly talk about placements and the rest of that. And also, in the end, I mean, this is a long list. I might not finish this session, so I might have to. Depends on how we go. I might have to review this and have another session on it. But I'm also hoping to talk about careers in public health. What are the different careers in public health? How do we find sort of like search for jobs in public health? Um, you as an international student, if you are, how do you find a job or look for a job in public health, especially within the UK? Or what are the requirements that you may want to keep in mind as you start your journey in public health, your program, and also looking for a job after your program? What else? Yeah, employer in public health, volunteering, all those jazz. So there's quite a lot that I think I have planned out. It would depend on how fast we go, because I would also like to have questions answered, not just me talking. So please, if you do have questions at any point, just stop me, and I am more than happy to stop the my conversation and respond to that, because it would be nice if it's more interactive than just me giving you information that you probably know and doesn't maybe relate to your need. Right. So what is public health? Just in a nutshell, I say public health is whatever you think it is, really, but it is more around looking at looking at health of population. So you're looking at health of people, yeah, at a population level. So that means we're trying to find ways to improve, promote, and enhance people's health, but not just at individual level, but we're looking at it holistically in terms of the general population. So what's happening with an individual, for example, that may affect their health, both individually in terms of the individual choices that they make, and also the societal or impact. So sort of like the social determinants of health that may influence choices that an individual will make. So for this one, it might be this is not a defined, this is just my own definition. So this is not a textbook definition of public health. So, but for this one, we're talking about issues around, for example, someone would ask, what's the difference between public health and clinical health or clinical practice? So, the difference really is that while a clinical person might, I'm not saying that's the only way they do, but while a clinical person would focus on treating one individual at a time, we as public health are looking for how we treat or how we prevent and promote people's health at a population level. So you're looking at groups of people, community of people, national and even globally, strategies that we can use to promote people's health nationally and globally. So that's part of what we do in public health. Public health as well, we're more towards like the gateway before you get to clinical settings. So we're interested in helping people before they get to clinical environment where they actually need some treatment, biomedical treatments or biomedical model of treatment. So we are more towards preventative measures and promoting people's health. So it's more around encouraging people, enhancing them, empowering them, and just giving them the tools that they may need to make better choices of their life. In addition to that, we also look at social determinants of health. So what are the things that are outside an individual's control that may affect them making the right choice. So an example might be maybe there's someone that is struggling financially and you tell them you need to be physically active, for example. This person doesn't have maybe the money to go to a gym, and so encouraging them to be physically active might not necessarily be something they will take up because you haven't addressed other issues that may prevent them from making some of these recommend or the choices or the recommendation that you have given to them. So I don't want to go too long in terms of what's public health. If you have questions around that, please just stop me while I go on this. The other thing to also talk about is who can study public health. So you may have known or you may have seen it that public health is quite interdisciplinary. So that means literally anyone and everyone can study public health. There's always something for public health. You could have public health, you could have engineers in public health, you could have environmentalists in public health, you could have definitely some people think it's just medical doctors. It's not. You have medical practitioners, you have nurses, you have lawyers, so maybe public health ethics and law. You so it's quite diverse, and anyone, I can't think of a profession that cannot be in public health. So it's really about how you fix yourself in terms of what part of public health you would want to address with your knowledge, with your expertise that may come um, from different backgrounds. And I think that's why in public health we have so many people. You have somebody that has studied maybe business and law, business or law, or I don't know, journalism and all that, and they still find a space in public health. So I'm saying this so that you know that you as an individual, you're not limited in terms of your course, because I'm receiving a lot of questions around that. I studied this, would I be able to have get admission in public health? I studied that degree. How can I get admission in public health? I think you can get admission in public health. The only thing would be that you need to package your personal statements to and tailor it towards public health. And I think that's what I'm probably going to talk about now. So the next thing is personal statement. So if you want to get admission, I'm talking about this mostly in the context of UK for now, in terms of getting admission with public health. I'm going to accept you, and I'm going to mute you. Is that muted? Okay. So in terms of public health, so in terms of public health requirements, so for you to sorry, Toby, do you have a question? Sorry, I know you've joined me. Do you have a question? You could stop me if you have a question, but if you want to add comments, please also I'm happy for you to stop me as well. This is hopefully going to be as interactive as possible, but I will try and share information in the meantime. Right. So in terms of requirements, I'm talking about this in the context of UK for now. So within the UK, if you want to get admission into public health, it would depend. I'm going to focus right now on the MSc program. If you're going to get MSc admission for public health, the entry requirements, usually you would need a public health degree or health related degree. But like that's like the general requirements, right? But like I said, you can also have non-public health related degrees or background, but it would depend on other things that would allow you to obviously be able to enter into the program. So you would need that at a BSc level. Now we're talking masters, right? So you will need a first degree at a BSc level, right? Ideally, most universities will tell you 2-1 or 2-2, but I think you can also use other degrees, right? Grades. Sorry, you can also use other grades. For example, maybe a third or a an HND. That can also be used, but it would depend on the university, right? So most universities will tell you on their website, if you open most universities in the UK, they will tell you 2-1 or 2-2, and so you will need to, if you have qualifications outside that or grades outside that, you will need to, my suggestion will be contact the university, because sometimes they would, depending on person specific scenario, they might look at your scenario and see some things that you're bringing outside those qualifications or that degree, and they would use that to admit you into the program. So definitely don't just cut yourself out because you don't have a 2-1 or a 2-2 for you to be able to apply for public health. You can definitely send in your email them and send in your query about, I have this qualification, would I be able to get into your program, and they would definitely get back to you. The other thing is, you would obviously, I think this is cut across all programs, is the what's it called now, the English language requirement. So evidence for English language, some universities would definitely take what's it called, WAEC, yeah, that's the one. So some university would take WAEC and some university would ask you for IELTS. So depending on the university, same thing, I would suggest you try and email the university. What I tell people when they contact me to ask about this is, I tell them, before you think of writing IELTS, write to them, list out what you have done. For example, I've studied in English in this place, I've studied this. And after doing that, then you send it to them as um then you send that to them as your evidence, right? I have WAEC, I have this. And then they sometimes will consider what you have done, where you have been, and use that to decide or to waive you writing IELTS. So always I would always encourage, before you jump into writing IELTS, try and do that as well. Then outside those things, the rest that you actually need is just more of whatever you can add into your portfolio to get that. So maybe work experience and volunteering, whatever role that you've been in, anything that you've done, even if it doesn't relate to public health, that you can put on that application, will be the next thing when it comes to entry requirements. So when it comes to personal statements, and so this is now me trying to link it to different, as like I said, public health is very multidisciplinary. So the different disciplines that you may be coming from and you're interested in public health, what would tell the admission office or the admission person would be about your link with public health will be your personal statement. So you need to try and write your personal statement as best as possible. One thing very key, obviously, everyone's story is different, and so your story will definitely be different from the other person and the next person. And so the the personal statement will be unique and should be actually unique to you in terms of what you're going to be telling us as why you want to study public health. Your personal statement should try and cover key aspects that is very, very, very essential. One of them is, why do you want to study public health? So try and write out a bit about you understanding what public health is on in your personal statement and why you want to study it. Now, if you as a person who is definitely not in the public health field and you're trying to move into public health as a, as a new sort of like new career path, you would now have to link your whatever the qualification you have previously to an aspect in public health. And I think this is like the bridge that most people find difficult to do. So I'm trying to look at one very, like I said, I think law is one of them. When someone study law and is like, I want to study public health, obviously law is like way out in the others on the other side of the spectrum. And then you have public health on the other side as well, so it's almost like a 180 degrees type of situation there. So you need to link it to public health. That's the thing. If you cannot find a way to bridge your background, whatever it is you have done with public health, they would most likely reject your application. And so, how do you bridge it? One of it is to look for a problem in public health or an aspect in public health. So, maybe a problem when you're talking about, for example, there's a public health. I'm trying to think public health disease or public health challenge that is going on, and your skill as that's whatever the background that you have, maybe data analyst, for example. I mean, there's always need for data analysts literally everywhere. So maybe data analyst, there's a lot of data that is going on now in public health. I mean, give COVID, for example, the data is endless. And so you can talk about your background as a data analyst in harnessing and really using your skill to help understand more in terms of what's going on and how you can help public health that way. If you're doing law, for example, you can also link that with a problem in public health. So identify some situations around maybe consent, maybe around ethical practices that are going on globally, maybe in some um, rural areas within a certain country, and highlight that problem in terms of this area. There's lack of for example, there's lack of ethical practices in da 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 da, and that's has led to this problem. So I would like to use my law background to sort of like address this problem. However, I need some exposure to public health and theoretical knowledge of public health to be able to do this to be able to solve or to be able to contribute to this the solution for this problem. So that helps you to link your background or whatever you have done in onto a problem that is going on within public health. I don't know if that has helped in any way in terms of how you can write your personal statement. Definitely, in addition to writing how you want to solve that using your background for wherever you're from, you should also then talk about what are the gains. So you identify first of all, you establish who you are, you talk about why you're interested very briefly in public health, you talk about an issue in public health that your skill that you have from your different background is going to help um, solve or at least contribute to solving it. Then you now talk about what are the gains, what do you think you get out of it. So like example, maybe the ethics and law, you can now talk about the fact that with your contribution, hopefully you would be not just educating people around confidentiality, ethics, consent, but you would also be reducing issues around human rights, denial of different human rights scenario that we're seeing in different parts of the world. So you sort of like highlights how you're going to use that the skill, whatever skill you get from the public health program, to then address some of these issues that you have identified. So you do that, and obviously the next thing in your personal statement should now highlight why that university. So why that university, why UK, of course, if you're going to UK, whichever the country. So just highlight a little bit about their um what's it called now, their reputation in public health in terms of their contribution to global public health, and the university itself that you're looking at, whatever the university is, their reputation, the program, the public health program that they're doing, the courses that they are covering, in terms of, for example, if you're interested in public health, ethics and law, and you chosen a university, or you're applying to a university that don't have ethics as part of their program, it's a bit difficult for you to be able to link up on why you're choosing that university, because it doesn't even have ethics, right? So you need to try and make sure that whatever area you're going to link up with is something that the university is covering. And we'll talk a little bit about the courses that you would take per term if you're in MSc, for example, or if you're doing a master's in public health. Depending on the university, this is it varies, but I would suggest these are the courses you should look out for, or some of these. So in addition, so anyway, that's the personal statement. So you talk about why UK very briefly, and also if you're going to UK or US or Canada or whatever, and then why the university itself that you're interested in. So why that university? You also talk about that very briefly. And finally, you talk about your career plan in terms of, in general, like in the end, I hope this would blah 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 blah. In the next 5 years, I would like to have I don't know, contributed this way, and help the global public health program or journey, or contribute my bits to public health. And that should be enough to suffice for you to sort of like get into a public health program, I believe. Some universities would, after this application, would set up interview for you. So they just want to hear about your story. In that situation, you would have to let your passion for public health shine through, right? And the questions they may ask would probably vary, of course, in terms of why you, but it will mostly try, and what they will want to know is, why are you trying to do public health, or why do you want to do public health as a program, as a degree? Why are you moving from your data analyst, statistical, for example, someone that is done statistics? Why are you leaving that, or why are you moving from that to public health? So it will be for you to try and make sure you shine in that regard. So what are the problems that statistician can solve in public health? Identify those problems and then talk about how you would like to solve them, but using the skills or knowledge of public health that you gain from their degree or from their program. And that should definitely get you going. Okay. Any questions for now, or should I keep going? All right, I'll take it as keep going. So the next thing I would like to talk about is schools that are offering public health program. So now within this is definitely within UK context. Unfortunately, I'm not talking outside UK in terms of these schools. So within the UK context, the schools that are offering public health programs, I think most schools are literally, a lot of schools are offering public health degree. And the reason why there are many schools that are offering, not all, of course, within UK, but the reason why many of them are offering it is because public health is a taught program. So when I say taught, there are some programs that are research degrees, but public health for sure is a taught program. So that means you're in class and you're being taught the contents, and then you're being assessed depending on the different assessments types that the university may offer. So there are some universities I would like to mention. I think I'll mention Bournemouth University. That's where I got my degree from public health. Bournemouth University is offering it. They start in September. Wolverhampton University is offering it. They start in September and January. So some universities would have 2 or 3 intakes per year. Some would only have one. Which other university? Sheffield Hallam is offering it. University of Glasgow is offering it. Glasgow Caledonia University is offering it. Northumbria, like a lot of university literally offers it. Now, so most universities would definitely offer it. Not all, but a lot would. So my suggestion would be, if you're interested in any university, just check out their courses and just see if they offer it. Now, that would then take away from that to types of public health, right? So within public health, there are some universities that are offering different courses or different types of public health. And so you will see some of them will be public health and maybe global health or something like that. Some of them would be public health and health promotion. Some of them will have their title public health and policy. Some would be public health and epidemiology, or epidemiology and public health. So they have different titles that they sort of like label their programs with. And so you need to review them. So where you have a public health degree, for example, that is public health and global health. That means that there will be some emphasis on global health. So if you're interested in global health, that might be something you might want to consider, because they would have public health program subjects, but then they will have more emphasis on global health. That's what that means. The same thing where you have public health and health promotion. So that means you would have public health courses, which are quite a few of them, but you would also have health promotion and health promotion activities, which will be more of their focus than other parts of public health. If you have public health and policy, obviously the policy means that you will have more on policy, analyzing policy, different policies around the globe and how the policies affect health of the population. So there will be more emphasis on that as well. And the other one is if you have epidemiology. So for those that are interested in statistics, or maybe your background is in statistics, you might actually like this one, because it will be public health with a lot more focus on epidemiology and statistics as part of it. So sometimes you will see some programs will be just public health, and some program will be public health and some of these different, and of course it's not limited to this, but these are just a few specialty or specialized areas that they also attach to some public health programs. Now, when it comes to types of public health degrees, in terms of your master's degree, so you could have MPH, and I'm sure a lot of you have seen it or heard it or come across it somewhat. So you could have MPH, you could have MSc, and you could have MA in public health. So with the MPH, what that is telling you is that the program is more it would most likely tend towards epidemiology and statistics with public health. So most MPH program would have, they will either have introduction to statistics as a module, and then they would also have epidemiology as a module. So you're more going to, obviously you can't really run away from calculation completely, but if you're not necessarily strong suited with calculation, some MPH might not necessarily be that much suited, because the focus of MPH would be more towards epidemiology and statistics, which is obviously more of calculation. You're talking about, for example, the risk ratio, prevalence, incidence, odds ratio, parametric, non-parametric statistical analysis, just different things on how to calculate population data, that epidemiologists use to understand what is happening in the population, right? Then when you come to MSc, and I think this one is the one that is more common in most UK public health programs. So with the MSc one, we're looking at programs that are public health programs that are more tended towards generalized public health. You would see they are having programs that are maybe like health promotion, would most likely be MSc in public health. If you have a program that focuses on health promotion, on policy as well, would most likely be MSc. So with that, they still have elements of epidemiology, but not as intense. The focus is not as intense in most MSc program, of course. The other one is MA. So this one, you could also have MA in public health. With this one, you're talking more around some social courses. You might not have epidemiology in an MA program. I think one university that I noticed that have MA in public health is what's the name of this university now? Yeah, Nottingham Trent University. So they have MA in public health. And so if you look at the courses that they are covering, I could see concept of health and healing, public health, sustainability, community, global ethics and public health policy, research method, international politics, and dissertation. So in this one, actually, they do not have epidemiology and statistics. So if you're interested in epidemiology and statistics, obviously MA might not necessarily, or this kind of program might not necessarily be what you should focus on. So with these, with the MA in public health, they are more towards social topics around public health, so how are people understanding health, the concept of health in the population, community health, interaction, healing, and health, So those sort of topics that are more social kind of focus is what MA or this MA program is sort of like focused on. Now, when it comes to subjects that you can cover or that you can expect to cover per term, so you most public health programs, especially the MSc ones, would literally have at least I think three courses or modules per term, and they could be economics, so health economics, epidemiology, health ethics, and in public health, health promotion. Then the term two, depending on most time you have three terms this is all about UK for now. It will be three terms, and the first term would be three or four courses, and then the second term would be about the same, and then the last term would be your dissertation program or dissertation projects that you do. So you could have health promotion, you could have policy, you could have non-communicable or communicable diseases. Also, some schools will give you about three or four core courses, and then they would expect you to choose maybe two or more, maybe two or three as part of your optional courses. So those optional courses they vary in different universities. You could have like environmental health. So that's where you're an environmentalist can then key into that as part of your optional course for your public health program. Some would have telemedicine, digital health, just different things that they sort of like pull together depending on your interest. So you can have that as optional as well. Now, when it comes to placement, I know most public health programs or most public health degrees in terms of MSc are not very they are not there's really not that many that have placement attached to them for now. So some of them you would have, I think the ones that have in fact, first of all, many of them would have public health placement for like maybe 3 months. So that would be like around a term. That's what most of them do. And then outside that, you would also have some I've one university I think many people probably know, Teesside, have placement for a whole year. Now the thing with placement is most universities or those universities that have placement attached, they most likely are not going to get placement for you, right? They would expect that you get your placement and but they will give you that as part of your program and your admission. So you would have, for example, 2 years, but 1 year will be in class, and the second year will be for you to go out and look for placement option where you could work. Now, when it comes to placement option, and this would link sort of to careers in public health. So, with careers in public health, it means what are the kind of things that you can do once you finish your MSc program, for example. So, one of them, this is first of all, this will be within UK context before we go maybe outside the UK. So, one of them is you could be public health commissioner. So, with public health commissioner, you're looking at you'll be working for those that follow me on Twitter. You will see that I shared the NHS public health job link. I can't remember which day was that, 2 days or three ago. With that one, what happens is you are part of a team of CCG. They call them the CCG team. So what they do is they are commissioner for public health programs that are under the NHS. So they go around and commission different programs within communities. They can be within local council as well, and they're sort of like known as a public health practitioner as well. So that can be a career for someone that's finished public health. You could go for doctor in public health, which is what I am. So you could do your PhD in public health as after your master's program. Obviously, if you're interested in that, I can talk more on PhD in public health and how to go about that. The other thing is you could be a researcher. So there, like I said, someone that is an analyst can definitely link up into research in public health and become a researcher as part of their public health career journey. And I mean, just few but not limited to all of this is a public health consultancy. You can be a consultant in public health, but this one is a bit more it requires a bit more time in terms of in the profession. You would have to have worked a while before you get into that scenario. Now, when I was doing my open day talk, when was that? I sort of like put some public health jobs and salary, and I would just like to go over them a little bit. So, like for example, where you're a public health officer, commissioner, just entering public health, what is the salary scale? Obviously, this is UK based. This is gross salary. So you could be looking at somewhere around 25 to 30,000 pounds per year, right? So if you're entry level into public health, in the UK, definitely, yeah, and this is not set in stone. It's just something I saw when I was doing my search online for my open day talk, which I did a while ago. So when it comes to epidemiologists, epidemiologists a bit higher, so you may be looking around 30,000 to 35 or so. Senior public health manager, so in this phase, you're getting into the middle row, you're looking at around 45,000 to 50,000 pounds. As a consultant, that is going around 50 to 60,000 pounds. And as director of public health, obviously that is, a very senior role. You're like going around 80 to 90,000 pounds. Like I said, not limited, but just a rough estimate of, if I finish public health degree and I intend to get a job in the UK, what kind of a salary scale am I looking at? But like I said, it's not set in stone. You could get higher, hopefully. If that's something you want to do. Now, careers in public health, sort of like internationally, within international context, obviously, I think we all know where some of our public health colleagues have been working. Some of them will be in the WHO, that's like one that comes to forefront. Another would be the World Bank. Because why? Because they have so many public health projects. I remember when I was doing my PhD, I applied for a World Bank project. I didn't get it, of course. Um, Not of course, but I went to, I think I got to the next stage. I was selected, and then but I didn't move beyond the stage that I got to, but I got to one stage, and then I was not shortlisted for the next stage after the other stage and the rest. But anyway, so you could have World Bank, you could have CDC, you could have, and in the US, the CDC actually have a lot of. I know one public health person that she did public while I was doing my PhD. She was doing her masters, and she actually got CDC fellowship for her to do while she was doing her MSc program. And during my MSc as well, when I was doing my MSc, a colleague of mine got an internship with WHO in Switzerland, and so she went for about 3 months. She had to pause her studies for that time, and she went. Obviously, the school was excited because it's obviously a nice opportunity. So they were happy for her to pause her program while she go on to do that. And I also know a colleague who's finished her PhD. We did masters in the same university. She finished her PhD, and she's gone on to Malaysia because she's got a job with the UN. I think she's doing something around maternal health and mothers health and the rest of that. So she's now in Malaysia for a UN project. So it's literally, when it comes to international public health, I mean, it's everywhere. You could go anywhere. USAID, UK aid, the list is endless, right? And these are just NGOs. Obviously, within a country, you could also work in their public health team within a country. It doesn't have to be an NGO. You could be a government worker and also get some of these sort of like roles going. So, for example, I know not everyone wants to stay back in some Western countries. So, if you want to go back to your home country with your degree, there are actually possibilities. At least I believe there are definitely going to be local NGOs, that's one, and they can also be government parastatals that have public health departments within them that you can also key into. Now, what else? What else? What else? Okay, so for example, you as an international student, you come into the UK as an example. Oh, I also forgot. There's a friend of mine. He's actually still working around there. I think he got a job in WHO right after our masters. Immediately we finished our masters program. He literally left the UK and went for that thing. He got it before he finished the masters program. But the thing is, he has been working in public health for some time in his home country, so it wasn't that it was just the masters. I think he needed the masters to secure that job. He's always had his eyes on that. It was a WHO program, and so he's always had his eyes on it. I think he just needed the masters to be able to, get that, and that was what he did. So that is also possible where you have some background knowledge and experience in public health. You just maybe need a master's program to tie everything together and then go for that job. And he did that. Well, I don't know if it's luckily or whatever I would call it. He got posted to Pakistan for his first. He went to US. They went to US for their training, and then he was posted to Pakistan. But luckily for him, they transport them by chopper from their hotel to where they need to work, because obviously security reasons, and then they take them back with helicopter at the end of the day. I guess it was nice. So anyway, that's sort of like one other thing that or possibility of where you could take your public health degree to. And this is definitely not the list is not exhausted. It's just part of what you could get when you have a career in public health. And this is the one I've not said. You could be me. Well, not me, but like you could go the route that I've gone, which is lecturer in public health. And so that is also something that is possible if you want to be in a classroom and if you're interested in just impacting knowledge. You could, once you finish your program, if it's your MSc, but ideally your PhD, and you can use that to be in classroom teaching public health as a degree. Now, when it comes to international students, so you as an international student, you've come into the UK, you've had your masters in public health, your degree in public health, and now you're thinking, oh, sorry, you've come into the UK for your masters in public health. Depending on your interest, if you're interested in staying within the country right after your master's or right after your program, or you're interested in going back to your home country, obviously those two would require different direction in terms of what you should do. But let's assume you're interested in staying back within the country, right? So within UK, for example, when you're doing your masters, my suggestion you would be for you to decide ASAP what you want to do and where you want to go with your program, right? So immediately you're coming into the country, you make that decision as soon as possible. So once that is established, oh, I'm going to stay in the UK, or I intend to stay in the UK, and I intend to maybe work in the public health um, field in the UK, then the next thing will be for you. So let's assume that's where you're headed at for now. The next thing will be for you to start tailoring yourself towards that goal. So the first thing would be, or what I would say is that within UK, most international students struggle because most UK employers, they require you to have UK experience, right? For you to have UK experience, for you to be able to practice, or for you to be able to be part of the public health program or public health workforce. So my suggestion would be, once you get into the country, how can you secure that knowledge? Now, some people would do what's it called now? Care and support is not public health. And so I hear some people are like, I've done care, does that not count as experience? No, it doesn't. That's not public health. I mean, that's maybe social work or something, but it's definitely not public health. So what you could do is to look at charity organizations. So there's different charity organizations within the UK, Oxfam, Cancer Research UK, Macmillan, British Heart Foundation, Diabetes UK. There are a lot of them. So all of these different organizations, charity organizations, they have different parts they play in public health. And so I would suggest trying to link up with them in terms of how you can start getting some UK experience. You could also look at local councils. So, for example, wherever your program is, you could look at local council, and they may also be or they may also be willing to take you up. So, for example, where you have maybe you're in a community, you go to their local council, they would definitely, all local councils in the UK have public health departments. Definitely, they do have. All you have to do is to check with them. For example, now that COVID, I mean, it's not yet completely off the table, but with COVID still sort of like around, they need a lot of people. Like literally, they are looking for volunteers non-stop. So that would be my suggestion as well. Maybe try and key into some local council projects that are public health based and use that to gain that experience. The other thing is within UK as well, in the context of UK, they are also interested in you having some public health um, qualifications, and this is what I'm going to briefly talk about. So within UK, there are different public health organizations that sort of like puts you on the register. So there's the Public Health UK Practitioner Register. They call it UKPHR. So you as a public health practitioner can register on that with that organization. And once you get that, honestly, it's almost like you most likely will get a job, right? But it's very difficult for you to get that. Because the thing is, once you get that, you're certified to be a public health practitioner. To register on that program, it takes about a year, but and you would have an assessor assigned to you, so the person would assess you as you do the job. You could get volunteering as part of that job. So if you don't have a full-time job yet, for example, as an international student, you do have the 2 years after your program, and that might be a time that you can use to key into some of those organizations. Because part of why we struggle as international students, we all know, is because you don't have that um visa backing, right? So, but now that you have those that 2 years immediately after your program, that can also be something that you use to get those experience and volunteering knowledge. Just pull everything together. You can use that to apply for the UK PHR, and you most likely will be off the market once you get on the register in that scenario. Because I mean, you're already certified, you are a public health practitioner. There's almost no employer that will question your contribution outside that. So, but it can be a bit of it takes dedication to get onto that register. But once you do get on it, like it's not I won't say it's smooth sailing, but it definitely adds up to how much you can then go in public health. The other thing is there's also something called Faculty of Public Health. So they are also like a public health registrar in the UK. With Faculty of Public Health, they do more of you can apply, anyone can apply for public faculty of public health membership. However, you for you to do that, you would need to get what's it called now, you would need to get a pass in their exam. So for you to become part of them, I think it's diploma membership or something. But you will need to get a pass. When I mean a pass, that means you're writing an exam, and you would have to pass that exam. The exam can be quite interesting. It is two. You have two exams. There's a part A and a part B. So the part A is more theoretical in terms of they're asking you public health questions, epidemiology, health promotion, ethics and law in public health, all those different aspects that you have covered in your public health master's program. So it's an exam. So they will ask you question, and then you will write the exam. Hopefully you pass that. Then you go on to the part B. With the part B, it's more about now writing what's it called now, it's more about doing public health in the presence of some assessors. So they are giving you some case studies and some scenarios, and they expect you with your public health knowledge to be able to provide solution or to suggest solution to all of that. So that would also be something to maybe consider if you're interested in the UK in terms of practicing or being part of UK public health workforce. So there's also something called the Royal Society of Public Health in the UK, but this one is more. This is like the easiest one you can attach yourself to, but they don't really give you any. There's really no qualification. There's really no register. You're just part of them as a member. You pay a certain fee. I think as a student member you pay £25, I think, and then as a full member you probably pay maybe like £100 or something. But what they do is so you don't do any exams, you don't do anything. I was part of them for my when I was in my master's and my PhD. I think I registered with them as a student member. They just share public health information, conferences, some webinar and training, and so they just keep you up to date with public health information. So that might be something to think about as a student. I mean, £25. Once you settle into the country, it might be a bit, easier to get, and just use that to stay on top of public health information and how you can develop your career as you go on. So yeah, I think that's all I have when it comes to I didn't think I was going to get through all of them, but I think I've managed to. Public health, it depends on where you are, where you find yourself. Honestly, financially, public health can be well paying, and it can also not be as much. I would suggest for those that are interested in well paid public health aspect, I think it is more towards um NGOs, all these areas in what's it called now? Developing, yeah. I don't know what the politically correct word is now, because we normally use low income countries, or you could use developed or developing countries. So let's say low income countries, they are mostly those are the kind of areas, to be honest, that you probably will get more money. I remember my friend that we immediately we finish our public health master, and his master supervisor actually suggested to him to do a PhD because his project was very good, right? So they're like, wow, this is fantastic, apply for PhD funding and go on. And he was just like, nah, I'm interested in WHO, right? In that program, he told me, I mean, that he was getting more than about $5,000, not pounds, every month. So that's a lot of money, right? The thing with the program is you're only allowed to do it for 6 months, and then you have to reapply, and then maybe you obviously the first one is the most difficult one. I remember when he was doing the interview, doing the whole selection process was intense, but once he got it, the finance, and with that money you are also not spending anything from about £1,000 dollars, sorry. Imagine you're almost not spending anything. All of that, your feeding, your accommodation is taken care of. Literally everything is taken care of. So the money is literally just piling up in his account because he wasn't spending it. And unfortunately, he was posted to Pakistan, so he also wasn't able to, like things were very conservative there. So go he didn't really need to spend as much. There wasn't that much expense. So, but just to say that it can be quite profitable to be in public health, but depending on the area that you are. If you're not in those places, if you're not interested in going down the route of NGOs, or the route of all these multi national health agencies, then public health may not necessarily be as productive. And also, if you have business ideas, you could also do public health with business, depending on what kind of business and your background as well. That can be something that you can think of. But most people, when it comes to business, they sort of go to NGOs. Mostly they do go to NGOs. So you start your own NGO, and that can be a way for you to start making some money with your public health qualification. I think I brushed on it, but I don't know. I think let me see if there are anyone that have questions. If not, I was going to talk about PhD roughly, but let's see questions first. Olumide, hi Olumide, your hand went up first. Okay, it seems Olumide's network is acting up for now. Cheta, hopefully I pronounced that right. Cheta, okay, is it just everyone's network is all right? So does anyone else have any question around what I've said today that and would like me to clarify? Okay, come on up. So who has question since Cheta is in GAO? Hopefully that is correct. Do you want to go over? Do you want to go on with your question in GAO? Okay, what is happening with the network? Because it seems everyone is hands up, but can't seem to. Um, Tommy, official Tommy, do you want to go on with your question? I'm wondering what's happening. Like I can see people's hands up. I'm calling name, but they just Toby, would you like to go on with your question? Toby. Wow. Anyone, you need to unmute from your end, please. Oh, thank you. Oh, thank you for that. Oh, I didn't know I unmute. I thought you could just unmute yourself and then speak. Okay. Thank you.
Hello, good evening.
Let's start one at a time. So we have a few. Good evening. Who? Let's start with Olumide because he. Okay, Olumide is gone. How about Cheta?
Okay, I just wanted good evening, everyone.
Hi,
When you
Cheta.
were explaining about the MA in public health, I have a friend that's just applying to Nottingham, but then when you were explaining, the network was off from on my side. Can you just elaborate more on that?
Okay. So what I said with MA in public health, I said with MA in public health, there's more towards the social aspect of public health. So it's not if you're interested in epidemiology, for example, and epidemiology in public health or those statistics in public health, for example, you might not necessarily or it might not necessarily be valuable for you to be going into MA. With MA in public health, like I said, they are more social. Like, for example, you're looking at social determinants of health, you're looking at community health and healing, you're looking at the social perspectives of health. So it's not necessarily you would probably struggle to find if you're interested. Of course, if you're not, then that's fine, but if you're interested in epidemiology, statistical analysis in public health, biostatistics, or the rest of that, may not necessarily be that program that you want to go into.
He's more interested in health promotion and health improvement.
Okay, so with health promotion and yeah, I think it was last week I was telling someone who asked me about public health. I did say that we don't. I don't mind if you're interested in public health or if you're sorry, if you're doing MA or MPH or MSc. It depends, really. I'm not very concerned about that title of whichever of the public health. What I'm more concerned about is for me to look into each of the program that is being offered by that university, right? And then use that to determine if or not they would be serving my purpose. So, for example, for this your friend that is interested in health promotion, I will check the university. I think if it's Nottingham Trent, they are not doing health promotion, or at least they are not having it as health promotion. Maybe health and sustainability and pub and community might be partially health promotion, but they don't have health promotion as its in its traditional form. So if I'm interested in health promotion, I'll probably not go for that university. But it depends on them, really. I don't know if I've answered.
I think that's really very good. Thank you.
Thank you. Who's next? Is it official Tommy? Do you want to mute yourself? Yeah.
Okay. Good evening.
Good evening.
Yeah. Good evening, everyone. This is that's been an eye opener, and Thank you for the space. I think everything you tends to deal with sometimes last month at last month was any I think it
You're
first
breaking
for
from my end a bit. I don't know if it's the same for everyone. Do you
sorry,
know?
can you hear me now?
I think yeah. Let's try again.
Okay. Okay. I messaged you on that. I sent you him last 2 weeks ago, and I was telling you how I couldn't get offers for Pumpkin, but um an admission came in last week, maybe six MSc.
Okay.
But my issue now is compared to that school, I think they have a special pass interview or eligibility interview for entry students for MSc.
Yeah.
And I really want to help out in aspects. What does that entail? What does that mean? I think that's probably one of the schools that does that. A lot of schools don't do that. Once you just pay the fees, they extend the class and start with the and stuff like that.
Yeah.
Then secondly, I want to add kind public health practitioner academics probably go into the medical field, like their prospect, sport prospect, where a public health student, delves into maybe medicine or nursing or something similar, or it's just to separate stuff. Then thirdly, you
Do you do you want me first? The network is a bit shaky, so I'm really trying hard to get the questions. But do you want me to answer each one and then go on with the next one? If not, I'll forget.
okay, that's fine. Okay, that's fine. That's fine. You can answer the first two.
Okay, I think if I get you correctly, you asked me about interview that you've been
Yes,
requested to do an interview in, I think, Middlesex.
yes, please. Yes, please.
Okay. So obviously some universities, I think my university, we used to do interview as well. We are not doing it currently because we have loads of applicants. So like it's just not feasible to do it for now. But previously it used to be done. So I'm not surprised that this university is doing. Many don't do for public health, depending on the course. There are some courses they still and would always do interview for. Now, with this university, I can't necessarily say what they are going to ask you, but I know for sure there are some basic question they just want to first of all find out what's your passion or why are you interested in public health and why are you interested in India university and why are you interested in coming to the UK. So my suggestion would be to find answers, obviously answers that are academically sound for those questions. So why do you want to come into the why do you, maybe for example, starting with why do you want to go to the UK or come to the UK for public health program? So you would have to provide answers in terms of the fact that in my home country, public health is not maybe at the forefront, and with UK really having most of their public health tied down, you try and answer it in a nicer way, of course. But like they have most of their public health programs. UK is more concerned about public health. They have public health agencies. They have, so you feel like UK will be a good place for you to come and get those knowledge on public health, as the case may be. Now, when it comes to the university, they might ask you why are you interested in that university. You might also have to give them an answer that also tailors to the university. So what kind of universities are they? Do they have any public health? What is the courses that they're covering? So you might say, for example, I'm interested in biostatistics or and epidemiology, and I can see this is one of the areas that your program cover, which is something that really draws me to you. I'm also interested in the university because of the location. It is located in not so maybe a nice, bubbly, but not too populated environment. So I feel like this would be a nice place for me to learn. You could also mention you know one or two persons, maybe one of or two of their alumni or current students who has also attested to the university as why you are also interested in that. And for public health, you would also have that in terms of my skills. That will be quite similar to what you have written in your what's it called now, in your personal statement. So your interest in public health and what you want to use the public health degree to do once you get it. So that might be sort of like the answers you will give to those questions. But like I said, they might ask you more questions or not, but the basics, I think these ones you might not necessarily be able to avoid them. Why are you coming to the UK? Why are you coming to our university? And why are you studying public health? Then there might be other not so obvious questions that would depend on them really. So I hope.
Thank you very much.
Okay.
Okay. Now,
The other
this one
question,
person, yeah.
I can't remember.
Okay, I was asking, okay, and a public health practitioner, like a public health student, delve into the medical field, like all medical field, nursing,
Oh,
mental health,
okay.
medicine.
Yeah, okay, I get. Absolutely, yes, you can. You can definitely go into, for example, with my program, I have it because I'm the program leader for my university. So admissions with public health comes to my table. BSc, I don't do MSc. So my BSc program, you would have some student, they will want to swap from nursing actually to public health, interestingly so, and some student would want to move from public health to nursing. The thing is, before you move, if you, let's say you finish your program, right? Let's say you finish your program in public health and you want to go into nursing, you would definitely use that, would give you a leverage in terms of getting into nursing, mental health, or whatever aspect of nursing you're interested in. But you would have to start nursing from oh, that has gone. You would have to start nursing from the scratch. So, for example, if you're going to do nursing BSc, you would have to start nursing BSc from year one. And if you're going to do nursing MSc, depending on your other qualifications, you would have to start that from year one. But if you want to practice nursing, in the UK, you need what is called the NMC, and so the NMC, they are like the regulatory body for nursing, and they have different what's it called now, they have different requirements aside from what the university would require from you. So you, once you finish your program, you will have to make sure that you are meeting that NMC requirement for you then to be able to apply for job. So ideally it would be you finish your MSc in public health, for example, and then for you to get into nursing, uh, you can, but you would have to probably start from scratch. So which is BSc or
Uh,
MSc in nursing, but yeah. But it's possible.
Thank
It's
you.
also possible for medicine as well.
Uh,
And nursing
okay.
actually do public health. All nursing programs have a module on public health. Definitely, they all have to cover public health. So you would have done part of some those programs that they would cover as part of nursing. They do health promotion in nursing, not as in depth as you will go into it in public health, but they do that as well. So yeah.
Okay. Thank you very much. Then, my last question. Um, Compared to that courses, I would like to know how tedious is the course, like at this chemistry level, because I know a lot of people would want to, like, okay, definitely you want to combine studying and working, how feasible it is to combine, because I can say my first module here,
Mm,
applied epidemiology, challenges in global public health, health protection, health economics, health promotion and health development,
yeah.
political public strategy, research methodology and presentation. Like those are my MS module.
Yeah.
How feasible it is to work and combine study on this course. Then lastly, I think I can see that this is being recorded. So I don't
Yeah.
know, will there be an opportunity to download it later? Thank you.
Yeah, I think yeah, this is being recorded. I think you should be able to download it at the end. If not, I can download it and maybe send. But I think you should be able to download it. I'm not really sure how that works. I just set it as recorded for someone that might be interested in listening back. Maybe they miss aspect or they want to listen again or something. But yeah, with public health now, this is how it goes. I think, and it's quite similar to other programs in MSc in the UK, which is the fact that you would have to be in class as an international student. It's very important. They do keep an eye on that. You would have to be in class for most programs. I think I've mentioned that you would mostly have 2 or 3 courses per term. So in a term, you would have 2 to 3 courses, depending on. To be fair and to be honest, when I was doing my MSc, it was intense. I had classes. Sometimes I would have classes all day. In fact, not sometimes, most times I would have classes all day. Um, you would have maybe 9 a.m. to maybe 12, and then you have a break, and then you have maybe 3 to 5 or something towards the end of the day. So most times when you're in class, when you're in school for that day, you're literally in school for that day. Um, Depending on as well, some courses like my university right now, our MSc is 3 days a week, but some are 4 days a week. I know where I did mine, which is in Beaumont Uni, my MSc was 4 days a week. So I had to be in class 4 days a week. And like I said, when you're in class, you're mostly in class. Hardly do you finish early before time. And everything is set on your timetable before you even start. So you don't think, oh, they're going to cancel this class, because they would not cancel it. I mean, except COVID happens, which is the only thing that would probably sort of like, but like what I'm saying is most likely it's not like, I mean, I studied in Nigeria those days. Of course, I believe it has changed now. But then when you're in class and then you're like, this lecturer will come, I'll just bounce it. Here, it doesn't happen like that. They would be in class. Someone would be in front of you, whoever it is, however they are going to manage it. So most likely you would have 3 to 4, definitely not less than 3 to 4 days in class. Morning to evening, most time you will hardly have days that you're not in school. Most schools would not teach on a Wednesday, but that's not set in stone. Some would. So when it comes to working, obviously you're supposed to be on 20 hours, the whole legal situation. So with that, you would most likely just have your weekend to do that. Some people would do night work as part of their time to work. So you could also work night time and then get on with class and try and keep awake while you're in class and just rough it like that. It is doable, is what I'm saying. People have done it and people are doing it. So it's not something that is not doable, but it's definitely a thick one. It's heavy for all your courses, depending on some you would write exam and some you would write essays. So there might be essays of like 3,000, 4,000 words, even 5,000 words that you will write for each of the courses. So each one you would have certain word count, and some you would have exam in place of the word counts, depending on, and there are some you would also do presentation. So it just depends. So but it can be intense. Long story short, it can be a bit intense, but it's also, and this is for literally all masters, because most masters in the UK are cramped into 1 year compared to maybe a year and a half or 2 years that some are. So they do pile a lot on you within that time, but it's doable and people do it and still work around their schedule, as the case may be. So I wouldn't want that to discourage you in any way. I mean, if I can do it and I'm barely strong enough and I manage to do all of that, I think anyone too can.
Thank you very much. This, I know I said that was the last question, but I actually wanted to ask from a personal perspective. And I did.
Yes, I am. I was hoping
Yeah,
somebody
yeah.
else would
From a
ask.
personal perspective, last question to start on me. Last question from a personal perspective. What has been your biggest challenge as a public health practitioner while you're studying, and now that you're a public health practitioner, what has been your biggest challenge or challenges? Thank you.
Okay, biggest challenges. I mean, I don't know because I came to UK. First of all, before I came to UK, I did a bit of health promotion and public health in Nigeria before coming to UK. And so that wasn't very challenging. I wouldn't say that was challenging. For me, I think it was more around doing my programs because I did my MSc and immediately, literally I barely, in fact, I had to go and ask for time because I literally finished my MSc and my PhD was supposed to start immediately. So I didn't really have, that was the challenge I would say I faced. So I did my PhD. PhD obviously is a different kind of worm that we don't even want to open right now. And luckily for me, immediately after I finished my PhD, did my Viva and I got a job literally instantly. So I'm not sure I've had challenges. I've had to work obviously as part of my program. Sorry, as part of me being a lecturer in public health. I've had to do research in public health, and so that might be some sort of like what I would say might be the challenges, and one of them would be getting funding for your projects. The other would be obviously just setting up projects while you're working because your teaching load continues, but you still have to get on with research and all the scholarly activities that has to go get going. So that would be it really. I have not really had any significant challenge, to be honest. Sorry. I'm not sure if that answers, but can I have somebody else with the question?
Yes, please. Hi, good evening to all.
Hi, good evening.
Thank you very much for this interacting space. I am an MSc student, but I am doing international health. I came across the space, and luckily, I'm actually taking some few optional modules
Mm,
on public health, such as health promotion, M&E, that's monitoring and evaluation.
mm,
So my main courses were health system and development, health policy, um, issues in international health, etc. So from your discussion, you mentioned about possible public health job prospect. So when I was asking, because I've already, it seems like from my area, I have a case for both international health domain and public health. So I just wanted to ask some few questions. How to access how to access voluntary job or internship while in the UK,
mm.
maybe before finishing, because as you said, most of the programs um, is usually very hectic during the first 6 months, but within the other 6 months, you'll have the options to do your optional modules, which are not really intense compared to your main modules.
Yeah,
So one, how to leverage on internship or voluntary activities or work that can help enrich your CV. And you also mentioned of about UK visas. Um, so I don't know because I think I had some people saying that they've really adjusted the regulations, which I am not sure of. So I'm not sure whether you have any idea of it that you could share with us that are currently in the UK, or any other thing that might be useful in the area of international health or public health, because I feel like I am both within both spaces. And
yeah,
once again, thank you for such a session. I am not really looking forward to do any PhD program right now, as you said from your from your conversation that you transited within the same period, and I didn't really want to have a similar experience from
mm,
my friends or colleagues who also found it very difficult to adjust to the PhD like immediately after completing their masters. So I'm really looking forward to employment opportunities. But maybe you can shed more light on it. Thanks again for such a session, and we hope and we'll have more such spaces very frequent so
yeah,
that we can learn on. And you're also doing well. Thank you very much. It's good to see you, let's say black women progressing to the university stage. Really, yeah.
yeah.
Thank you.
Thank you so much for your questions. That's quite encouraging and very kind of you to mention some of those things. I actually do have, I also want to say, I have like one of my big mentors here joining us. Unfortunately, I was going to have him speak, but he can't because he's in a noisy environment. But thank you, Pramod, for joining us. He is, I mean, I met him in public health. It's like he literally held my hand while I was in school and just push me through the whole of my PhD, as the case is. So anyway, coming to your question, so within the UK, like you have said, yeah, getting getting voluntary role can be a bit challenging. So what I did say is it depends. First of all, it depends on the university. There are some universities that have internship. For my universities, I said my university, we do have internship option, not option, but like we do have internship calls for students. I remember a colleague was doing something around COVID and evaluation of COVID within the local council that we're in, and he had an advert out for public health students to apply. There was also a mental health. I was part of that project, the mental health one. We had about maybe 4 or 5 research assistants for public health within that project that we did. And so that would be one place I would suggest. I don't know about your university and what's happening there, but internship within university might be a place to start from. Outside that, it would be local councils. So I did mention in my talk, or what I was saying earlier, that within the local council they all have public health departments. So I would suggest looking into those local councils and their public health department. For example, I'm in Newham right now, and so if you go onto Newham website and just type on voluntary public health role, something would come up. And for now, it will most likely be COVID, because that's like, on the forefront. So COVID voluntary role or something like that. And I had a thread on volunteering about what, maybe days ago, and I'm trying to compile a list, but not in the UK. I'm trying to compile a list of voluntary organizations that you can volunteer in Nigeria, because most of the question I'm getting around that is like, where do we go in Nigeria? And I'm thinking there has to be, and I've found a few. So I'm compiling that list, but not in the UK. Maybe I will probably get to doing that as well for UK in terms of public health and health related options. But the other, so that would, I would say, maybe look into the local council within your environment, within your location. That might be one to also consider. And the other one is charity organizations. Yeah. It's just stuck in my head. Charity organizations. So I, for example, I'm interested in diabetes, and so I would definitely be looking into volunteering for Diabetes UK. And if I'm interested in cancer research, so all these charity organizations are also up places that you can, write into them and see if you can volunteer for them for certain period. So that would be my suggestion, really. Now, when it comes to job, obviously, job in the UK, I talked about it very briefly, that within the UK, it depends on your experience. Most UK public health employers would be interested in you having some UK experience. And that is where volunteering comes in, where you have been able to volunteer for some period of time and participated in executing, few public health projects. You can then use that to apply for those jobs. There are jobs, most of these jobs are either with same thing, they are either with charity organizations or they are with government agencies. There's really not that many NGO option like we have in low income countries, so it's not that those are not very prominent in the UK, but you do have government organizations, local councils, NHS do have some public health roles, CCGs, all these commissioning groups within the NHS. They are part of employers for public health graduates. But the caveat, or what the part of it that I would say, is you would have to try your best to get public health experience within the UK for you to be able to secure or bag those roles or jobs. Now, when it comes to visa, you did mention about visa. I think I did say a little bit about the post-study visa, and I would hope you know about it if you're a student right now in the UK. That's like the in thing. That's like why everyone is interested even in coming to the UK. You would you can have that, which is the outside the your program 2 years, for you to be able to gain that experience, especially the first year of that 2 years. My suggestion would be for you to run around making sure that you secure those experience. And the second year, while you're doing that, obviously you can be applying. While you're gaining experience, you can be applying as much as you can. And then the second year will be full force applying for roles, getting roles, making sure you are able to secure at least one job before the end of the second year. So that would be my response to that. I don't know if I've addressed it.
Yeah, just a follow up on two questions. So you make mention of the charity organization or branch organizations or roles that are within your own region. So if you want to search for those opportunities, literally, do you just like voluntary jobs, maybe depending on your location, you add such things, or
if you
and then sorry,
okay,
and then about the post study visa, because I'm not sure. Well, I heard about it, but I'm not really sure when it is effective or so, because I was actually in the UK last year.
okay,
So I just wanted to know, do you wait until your visa is totally expired before you apply for it, or you can apply when you complete your program so that you can extend your stay?
okay.
Thank you.
You're welcome. For those organizations, I would say you should go to their website. So, for example, with Diabetes UK, you just go on www.diabetesuk.uk or whatever it's called. Just type in Diabetes UK on Google. Go click on their website itself. You search volunteering or voluntary, and definitely something will come up, because they are always looking for people, all these organizations. But you would have to search. And if you're looking for local council, you would also search, maybe, what local council do I know right now? Maybe Newham. You could just go to Newham website and search diabetes, and search voluntary roles, and those will pop up. Obviously, you would have to contact some people and maybe present yourself, and they most likely will be happy to take you on, depending on whatever the project that they have going on at that time. Now, when it comes to this, your second question, post study visa, that's literally like another space on its own. I have made a video on YouTube, because I do have a YouTube channel. I've made a video on YouTube, and it's literally my name, same name that I have, Fola PhD, I think so. Well, if you go, if you for the post study visa, you do have, there's a lot more, but I'm just going to summarize this in the fact that if you're a student in the UK and you've completed your program, your MSc program, you have graduated, you can be eligible for you to apply for that post study, which is 2 years. Your student visa must not expire before you apply. So that means you finish your program. Normally, you will still have some, maybe 2 months or so between your completion of your program and your visa expiring, or more. It depends on your visa. Before your visa expire, your student visa expire, you must apply for that post-study visa, but you have to have graduated. So I was speaking to someone, and the person said, where you fail a course, so please try and focus on your study, make sure you pass, because that might affect. I heard when someone fail a course, and you are rewriting the course, because within UK, when you fail a course, you can actually rewrite it, and then you get to rewrite the course. It depends, you may have to chop into the time, that time that I said is left between your finishing your PhD, sorry, PhD, your MSc, and your visa expiring. You may chop into that time, and if you get into that time, it might affect you get graduating, right? So you haven't yet graduated, and then it becomes an issue because you can't apply for that visa. So do try and avoid that as much as possible. You finish your courses, you have your transcripts ready because you have passed all your programs, and then before your visa expires, you try and apply for your post study. So that will be the summation, but there's a longer, and I might have a space on the post study work visa for those that may be interested. Shall I have someone else? Thank you for
Thank you,
those
ma'am.
questions. I'm happy to go on, but if I can have someone else question, we can come back if you have any
Yes.
further question. Okay, Adesina.
Okay, thank you very much, Dr. Fola, for the insight so far.
My question
Okay.
is, though I'm a recent Vietnam medicine graduate, looking
Mm.
forward to opt for public health for my graduate and for my graduate studies for my masters. But like I've been thinking or hearing that the public health space now, for example, all the medical courses, most of us we love that aspect. So like I see some competition in the field. So I want to ask, like as an experienced public health practitioner or an advocate, can you tell us maybe a part of public health that maybe you can advise a potential student like us to venture into, that probably it has more career prospects, both maybe research minded or research wise, and at the same time it is lucrative. I will put, So that's basically my
Yeah.
question.
Okay.
So that in the space, when we have that competitive advantage over others. Thank you.
Okay, thank you very much. That's nice. I'm not a medical practitioner, so obviously, my answers will just be based on the public health part. So with the public health, definitely, I think not most, but quite a good amount of medical practitioners do go on when, especially when they are going for MSc. I think the not obvious, but like one of the places that they go is public health. Well, I wouldn't. When it comes to career prospects, you definitely with your background in medical practice would impact on your career prospects in terms of what jobs you can apply for. But for you, for example, you're a veterinary medical doctor, I believe, if I heard right. So your
Yes.
okay, so your link would obviously be I would think maybe jobs that I have to do with zoonotic diseases, those diseases that are passed on from animals to humans. So you would definitely have some space in the NHS and the research team. So it probably would be research team researching some aspect of public health within those context. But really, it just depends. I can't honestly, I can't tell you this is the one that is more lucrative, or this is one that is not. And obviously, I mean, I know there's this person is an aunt, actually a distant person, but she did public health, sorry, she did veterinary medicine in Nigeria, and she came to the UK to do her master's and PhD in public health. And she's back in uni, she's now in one university like that in Nigeria, because yeah. So, and she's heading right now, she's the one heading the for her state, she's the one heading the COVID-19, obviously, because COVID has a origin of being zoonotic in nature, right, from transmitted from animal to human. So she's in charge of the advisory committee to the governor on COVID and the rest of that. So it just depends on where you want to go. Do you want to stay in UK? Do you want to go back to your country? Do you want to be in academia? But one thing is, your medical background definitely does have advantage. Also, what you could also think about, for example, if you're interested in the UK or staying in the UK, is to also consider maybe applying for there's something they call it's under the FPH, which is the Faculty of Public Health. There's something they call I think it's medical training specialist. But that's a program for medical practitioner. I do know it's for medical doctor, but I'm not. I believe you guys should also be able to access that specialty program. So that can be quite lucrative, but it can be intense. The training takes a long time as well for you to become a public health specialist with that program. But once you do finish it, it can be quite lucrative. So maybe look into that one if you're interested in UK, of course. If it's your home country, I mean, I think the sky is the limit, depending on what direction. If you're going to academia, if you're going to field practice, if you're going to in public health, really. I think I mentioned, I don't know if you were here, I mentioned colleagues going to WHO and UN. I do currently, the other lady is currently still in the UN um program that she's gone for. So it just depends really on what direction you want to take your career, to be honest.
Thank you very much. Thank you very much for the invite.
Okay, thank you. I think
Hello,
Morenike.
good evening, ma.
Yes, Morenike.
Yes,
I had you. Sorry.
yes, ma.
Good
Yeah, good evening,
evening.
ma.
Good evening.
Thank you for the insight. At least while listening to you, I've been able to differentiate between MA, MPH, and MSc in public health. Okay, my question is if I, for example, if I get admission to study public health in the UK,
Yeah.
I'm actually interested in reproductive and family health, HIV/AIDS, cancer. So,
Wow,
can I specialize?
you're interested in everything. Okay, please go on.
Okay, so am I to specialize after my MSc, or will it be why doing my MSc? There'll be a course for it. Will it be a course, because you mentioned something on health and promotion? You also mentioned so is there specialization in MSc public health, reproductive and family health, or will I specialize for reproductive and family health after my MSc program?
Thank you. Right. That's quite a nice question. Really lovely that you brought that up. So this is how it works, right? When you come into the UK, for example, or even any school, any country, but let's use UK as our context because that's where we're sort of like. So in the UK, once you apply for public health, right, and you get in, they would give you. Okay, first of all, if you're interested, from my perspective, anyway, this is not it's not set in stone, but I'm just going to say from my experience of being in university as a student and also now as a lecturer, if you're interested in an area in public health, so for example, the areas that you have mentioned, they all seem to fit into global health. So if you're interested in global health, because it's in global health that you'll be looking at maternal health, maybe HIV and AIDS. I think you also mentioned cancer also. So I would suggest you look for public health program that have global health as a course, right? As a module, we call them module, or what do we call it in Nigeria? I've forgotten. What do we call subjects? Courses? Is it courses? Yeah, course.
Yes.
Yeah. Okay.
Yes, ma'am.
Okay. Fab. So you would be looking. I would suggest you look through the university and make sure there's public global health in it, because that's where you would have that. Hey Salifu, you're here. Do you want to come up? That's one of my organs in public health. So yeah, so you would want to look for courses. You would want to look for courses that have global health in them. Also, once you get into public health, say for example you don't manage to get global health course, for example, once you get into public health, you would have courses, like I said, and within those courses, most time the method that we use to assess students is for them to pick health issues that they're interested in. So you pick a public health issue and then you walk your way, whatever the assessment for that program is or for that course is, it will be towards that topic that you've chosen. So for example, if you're interested in HIV and AIDS, you're going to be working on maybe health promotion. You should have your health promotion topic tailored towards HIV and AIDS. You can do health promotion in HIV and AIDS, right? If you have a community, maybe policy and practice, you can talk about policy on HIV and AIDS as your topic that you have chosen. So whatever whatever assessment you have, you can always tailor it towards that aspect that you're interested in. So for me, for example, when I was doing my MSc, initially you might not know where your fit is at, and that's fine. For you that you seem to have known, that's also good. You just tailor your questions, your assessment towards that place. So for me, I was interested in, I did HIV for one course, I can't remember. And then I finally fit into diabetes, and that's what I felt, okay, this is I want to sit. So everything I did after that was towards diabetes, and my dissertation, and that's what I would also suggest, your dissertation should also be focused on, if it's HIV, for example, your dissertation should be focused on HIV. Once you do that, you don't necessarily need to have another qualification, depending in terms of, you cannot definitely specialize, but it depends on what you want to do with your MSc once you have it. So, for example, if you're going for PhD, you would obviously that would be PhD, right? But if you're going into job roles, so you may not necessarily need another qualification if you have been able to manage to gather some work experience in HIV promote, for example, health promotion in HIV and the rest of that. You may not necessarily need to also have any other qualification once you have that experience as well.
Thank you very much for your question, for answering my question, ma. Okay, I also have another question. Someone mentioned switching from after a master's in public health, and the person switched to studying nursing.
Yes.
Your reply was that you said that you mentioned that you have to go back for BSc in nursing. But I thought that someone can go for, there's a program in UK called MAN, which is Masters in Advanced Nursing. So this program, one doesn't need to have a BSc in nursing before you can enroll for the Masters in Advanced Nursing. I don't know if you've heard about that.
I haven't heard about masters in advanced nursing, but one thing I do know is, like I said, nursing is and I think I actually have someone that would be very fit to answer this question. Dr. Yakubu, would you? Because he's a nurse, so he's a trained nurse. Dr. Yakubu, would you mind?
Hello, can you hear me?
Yes, we can.
Yes, sir.
Yeah, so they call it graduate entry nursing. Yeah, you can do that if you have a degree in any of the subject, especially health-related one. So Nottingham, for example, where I completed my PhD, they have that. So if you have a degree in any of the health-related background, or sometimes it may not necessarily be health-related, any degree, you could do the graduate entry nursing. And I think University of Central Lancashire, which is in Preston, they do what you are talking about, the masters in nursing. So, but you may need to check, because I have recommended somebody, I did a reference for somebody for a similar program. So I think it is feasible. But we also have graduate entry nursing, where you could just switch from any of your graduate program into the nursing program as well.
Okay. Please, sir, can you repeat the name of the university? So university is in Preston.
University of Central Lancashire is in Preston.
Okay. Okay, because I have a first degree in biochemistry. So
yes. You could decide to do either graduate entry nursing or the masters, which I'm not very, very sure about it. I did a reference for somebody, and I think it was along the same line. Mm. But for the graduate entry nursing, I'm very, very sure about that.
Okay. Dr. Fala.
Yes, thank you.
I have another question. No, it's not really a question. The thing is, I took a DM 2 weeks ago, and you haven't replied.
Yeah. I'm so sorry. I'm swamped. That's why. Sorry. I'm trying.
But... What I sent is that please, I am looking for maybe a scholarship or a funding or something that can maybe take out how will I say it? Sorry, if you can be my supervisor, something like that. If you can be my supervisor, or maybe a scholarship entry in your university, or yes, ma'am.
Well, first of all, I want to say a very big thank you to Dr. Yakubu for helping us out with. He's a trained nurse, and he's a he's now an academic in public health. So in palliative care, I believe in nursing. So
nursing palliative care.
Yeah, so he's well experienced both as a nurse and also as an academic, and Thank you so very much for helping us out with that. Now, when it comes to, and I think again, I would sort of like go back to Dr. Yakubu in terms of when it comes to funding. I think he understands well where we are at when it comes to funding. Funding is something that we all struggle with as academics. I do not right now have funding that I can say is available. But what I would say is that with funding, it depends on what you need funding for. So if it's MSc or PhD, they are different, and there are different bodies that fund them, or to an extent. So I would suggest right now, it seems your questions are tailored towards MSc. And so with
Yes, ma'am.
MSc, is you're less involved as an academic to give someone an MSc scholarship, really. So I would suggest going through the general routes within the UK, which is for you to look at MSc uh, funding bodies like the Commonwealth, like the Chevening, like and apply through them. Also, there are university specific funding for MSc as well. So depending on most funding right now, they are sort of like quiet because we are coming to it's not really this time of year, you don't really have many of them open. But when we're coming towards September-ish, August, September, and October time, there will be many of them open to maybe November period, and so that will be for next year's intakes. Because so those that they have selected right now, sorry, for last year, September, October, November application that were open, most of them now are in the process of either interviewing and compiling compiling the applicants for start of September. So the next one will definitely now be towards September, heading to the next September. But I do post scholarship on my timeline, and unfortunately I don't keep tab of which profession. I just post them. So whichever one sort of like fits, then MSc, PhD, I do post them. Even some BSc, not so many, but I do post them. So that will be it in that question. That's sort of like what I would say. Now, when it comes to me supervising within the MSc route, supervisor is quite university specific. So I won't be able to supervise you if you're not within my university, for example. And even then, I might not be able to supervise you if you have not been allocated to me to an extent. With PhD, is the PhD one that is a bit more flexible in terms of your selection of supervisor to an extent, but not necessarily within the MSc. I see.
Okay,
Yeah.
okay. So that means if I apply to your school, I can be assigned to a different supervisor. It must not be
You. Yeah. I mean, for my school, and it's not every school that does this, for my school we do allow students to suggest. So while you start and then you're like, oh, I want this person, depending on your topic. So what we do is we assign students based on their topic and research method that they want to use. So someone that want to use qualitative research method and their topic may be assigned to a qualitative expert and research area, or somebody that is quantitative. So if, for example, you're like, I want to do something in diabetes using maybe qualitative or quantitative because I'm sort of mixed method, then you may be assigned to me. Does that make sense? And you may be like, oh, I think Dr.
yes,
Fola. Yeah, so that's how supervision works in MSc.
Thank you very much, Doctor.
Thank you. If you do have other questions, I will go to other people and we can always come back. Can I quickly go to Dr. Salifu Yakubu? Dr. Yakubu?
Okay, thank you very much. Pardon me, I'm at home, so I have my battalions around. Yeah, so I have what I call 10 bullet points that applicants need to know when they are applying for a scholarship in the UK, specifically. So first of all, the first thing that you need to be familiar, and I think Fola has talked about some of them, so it might be repetition in some places. But the first one is you have to be familiar with the eligibility of the specific scholarships. So sometimes age limit, country of origin, some scholarships are not open to all the countries. So you need to be aware of that. Some too are gender specific. So if they say it's for women and you are a male and you are applying, you are wasting your time. Then degree classification and also sometimes program specific. So that is becoming familiar with the eligibility. The second important thing is to know the aim or the purpose of the scholarship so that you can prepare your statement in line with that.
Dr. Salifu.
Hello?
Can I just interrupt you 1 second and say, I hope you guys have your pen and paper and you are getting these gems that is being delivered right now. Thank you. Please go on.
Okay. So the second one is knowing the aim or the purpose of the scholarship. And that help with the preparation of your statement in line with the purpose. So for instance, if my uncle has died of, let's say, prostate cancer, and because of that, I have dedicated some fund that I'm using it for prostate cancer research, and somebody apply and say that, you have glaucoma in the eye, it doesn't meet the aim. Are you getting it? So you need to know the purpose or the aim of the scholarship. And sometimes what we do is that you try to weave your story around that. If you really want to get a scholarship, sometimes you may not even necessarily have an interest. Some of them will, cross your path, but you try as much as possible to weave your statement around the aim or the mission of the scholarship. And the third thing is you have to be precise and respond to specific questions. And you have to demonstrate how you meet the criteria. There are a whole number of people who are applying for that scholarship. So the fact that you said I have first class or maybe I have second class upper, it may not necessarily be sufficient. You need to demonstrate that you meet the criteria by adding some of things that you think that may meet the requirement that they have enlisted. And there are so many ways to do that. You could, talk about things that you've been able to do even outside, university. Sometimes there are some people, for instance, most of my example may go into healthcare and, let's say, nursing. If you are engaged in some volunteering work or other things, you may need to bring all those things inside. Sometimes some people try to underrate some of these things that you do. You can even be, volunteering in the church or a mosque, in terms of health-related issue. Bring all these skills, to their attention, and that will, make you stand out. The fourth important thing is you have to know the deadlines, and you have to start well ahead of time. And as Fola said, most of the scholarship for this year, the deadline has already elapsed. So if you are planning for next year, you should know when is the deadline for the various scholarship. And I'll talk about a few of them. We have the Commonwealth Shared, Commonwealth Scholarship, Chevening Scholarship. Then we have university-specific scholarship. So maybe London School of Economics may have a particular, scholarship that is only available in that particular university or department. So, for instance, in Nottingham, they have a scholarship that they call Developing Solutions Scholarship. And it is only Nottingham that is available. And that one is targeted, West Africans, Ghana, Nigeria, and other applicants. And sometimes it does take the full tuition fee and stipend. So the fifth point that I want to talk about, if you are in doubt of anything, try and email the scholarship and find out. But in most cases, most of your questions may be addressed frequently asked questions. So do check that place first. Find out. And when you are in doubt, you can email them. Even that tells you that, they tell them that at least you are very, very particular about it. But please do not ask questions that are very obvious. They've already answered it in the frequently asked questions. And some scholarship also require you to gain admission offer before you are considered. So just like, I talked about during the eligibility, you need to check. There are some scholarship, they want you to have the admission offer before they consider you. Some too, they could just offer you the scholarship without having admission offer. So you need to do that. The seventh point is do ask people who might have secured, particular scholarship. And Fola has done an amazing job. I've been seeing most of her trade, telling some tips about how to, get a scholarship. So they are the rightful people that, you'll be asking specific questions. And mostly, what I will do is that try and do your homework as much as possible, because a lot of these people are quite busy. So if, for instance, I've helped a lot of people from Ghana, where about 7 of my students had scholarship to UK for masters, and one person has had a PhD. There are a lot of people that I'm a bit, very principled person. Somebody even wanted me to create an account for him, and I said, no, I'm not doing that. Excuse my language, that nonsense. Somebody who has married and given birth, you cannot create an account. What can you do again? It means that you are not even qualified for the scholarship. I told him, I'm very, very straightforward person. So you need to be very, very aware of the things that you will be able to do, and there are some things that at least you need support from people. And me, in terms of even writing statement to support and other things, I do help. For that one, all of us at one point in time will need help. But to say somebody should create an account for you, Yahoo or Gmail, that one, even if I'm part of the panel, I don't think I'll give you that scholarship, because you can't do well on the program. The 8th point is that you make sure you have all the requested documents. So normally what I tell my students is that create a folder, start populating those documents. If you don't have valid passport, you need to get it. Get all those things, speak to people who are ready to give you references. Some of them too could get a reference and keep. Some universities who also want the references to be sent to them direct. So you need to be aware of all these things. Then you have to also show a clear demonstration of why the specific university you are applying for the program has the expertise to help you achieve your aim. So aside all those, qualification that you think you possess, you are the best person, but do you think, there's enough, the technical expertise in the university? So this particularly relate to PhD. Before we give any admission tutor for PhD, so I'm quite concerned about this one. Before we give any admission to anybody to do a PhD, we make sure that we have a supervisor who is able to supervise the person's work, because the PhD is, subject driven or expertise driven. So if you don't have the expertise, you cannot admit somebody into the program, and you will now be looking for supervisors. So we need to think about all these things. But for most master's programs which are taught, it's not really an issue. So just in case somebody is considering a PhD. And perhaps the last point is that you have to demonstrate your academic achievement. I want to emphasize that one. And or your financial need. Somebody asked about scholarship. So you want scholarship, but you have not demonstrated enough, evidence that you are really in need of a scholarship. The fact that you've had a first class, second class doesn't mean that automatic, because most of the scholarship, here again, it links back the aims or the mission of the scholarship. Sometimes they say they are giving the scholarship to people who are, unable to do the PhD or maybe a master's in UK without the scholarship. Sorry, my small girl is crying at the background. So you need to talk about the fact, perhaps maybe the work that you are in, your salary is about, let's say, 10,000 naira or 1,000 Ghana cedis, and when you change this one, even if you work for 5 continuous years, there is no way that an amount to be able to pay a UK, school fees. So you need to demonstrate. You need to let them know. So one, the panel members read this one and understand your circumstance, it kind of move them than just, letting them to kind of assume that you are not able to kind of pay for the fees. So I wouldn't want to talk too much. these are some of the points that you need to consider. And I'm happy if anybody needs specific clarification on that.
Thank you so much, Dr. Salifu. That was very, very in-depth, detailed, unexpected gems just drop back to back. Thank you very much. I do hope, like I said, you guys have your pen and paper because I had them. I had mine. I hope you had as well, and just jot down because this was valuable from, I mean, experts in the field. So thank you. Who else? I think it was Mami.
Yeah, hello.
Hi, good evening or good afternoon, wherever you are.
Thank you very much for this opportunity, Dr. Fala. Please, I would like to find out for someone with a medical background and is about to complete MPH, who is also interested in focusing on epidemiology. Is there, what does it entail? Do you need to do some specific thing like specialize in just epidemiology, or you having the MPH is enough to be an epidemiologist? If you have any idea about that, could you please enlighten me on that? Thank you.
Okay. I think for that question, first of all, because you have done an MPH, I think you already have introduction to epidemiology. Now, if you have been involved in projects that are around epidemiology, then I wouldn't say you do need any specialized or specialist course. But if you don't, so that means wait before you obviously, especially if it's in the UK, like I said, you do need UK specific experience. So if you are in the UK and you have done MPH, but prior to that you haven't done anything around epidemiology, definitely you would need some epidemiology program as well. But where you have done so prior, or you have some experience during your program, then you probably don't need to do that outside the MPH. But it all depends. And I would suggest you look at MPH, no, sorry, look at epidemiology jobs, look at the person specification or job specification for them, and see what they expect from you as an epidemiologist, and see what you, if you can actually do or not do some of these things. Where you can't, because probably your area prior to that is not epidemiology, you may need to then you may need to have some other epidemiology specific, and there are programs that are specifically just epidemiology in the UK as well. So you may need to consider doing that outside your current MBH program.
Okay, thank you very much.
Thank you. Bambi, your hand isn't up, but I remember it's been up for a while. If not, so do you have question? If not, Sammy.
Hello, good day.
Good day.
Okay, so I wanted to ask about a master's in public health administration.
Okay.
Okay, because I studied biochemistry and I'm not interested in clinical. I'm mostly interested in the business part of public health based on my past working experience and stuff. So I don't know if there's, I know there are schools for it, but I don't know if there are scholarships for that. I just saw today that NHS has a program they do for it, but the applications are closed because I've seen it today.
Okay. Well, I mean, like we said, and I think Dr. Salifu did hinted at it. Most of the UK scholarships for MSc, even some PhD, but mainly MSc, are sort of like dwindled down and they are closed for now. Generally within UK, there's really no specific what's it called? There's really no specific scholarship for one course, right? So I mean, for public health, there's really no specific scholarship that I would advise that this is solely for public health that I'm aware of. There might be, but I'm not aware of it. But there are scholarship for masters, and in those scholarship you will see they might list out, so you will see different courses that they list out, and most likely public health would usually be one of them. So I would suggest any scholarship. It doesn't have to be public health specific, because it's very, I think it will be very slim for you to find just public health specific scholarship within UK university. I'm not aware of it, but you could look at public health. Sorry, you could look at scholarship in general for masters, and then you will see that public health is part of the programs that they are happy to fund. But right now, there's none that I can direct you towards. I would, and also I would always suggest, it's not when you need, and I think Dr. Salifu hinted to this. It's not when you need public scholarship, sorry, that you would actually prepare for that scholarship. So don't wait until scholarship season open again, because they will be opening, as soon as, once this round of scholarship is done, they admit the students in September. Immediately, the next round is opening. So before that time, you should have all your documents and everything that Dr. Salifu has hinted at ready for you to be able to get on once you the scholarship opens. But for right now, there isn't. But I would say, don't wait, please don't wait until they come before you start pulling your documents and everything you need together. Write your statement of purpose. Why not write it now? Get your passports ready, get your transcript, look into your English requirements. Do you need IELTS? Do you not need it? Make sure that is down to the T. Remind or hint at your referees. So tell them, oh, I'm going to request your support because I'm writing da 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 in the next few months. I might be needing you to write, draft. Even sometimes you can even go ahead and draft a referee reference letter for yourself and have it forwarded to them once you get to that point, for them to be able to maybe edit it, take things out, whatever it is, depending on how busy the person is. If they don't need it, of course, they will write however they see fit. But if they do, you can also consider that. You can also, I mean, just be prepared, just be ready, is what I'm saying, before that position or the advert starts rolling out, because they will come and they come very fast. And so before you know, they are all closed again. So that would be one suggestion I would say. But right now, there isn't any scholarship that I'm aware of that is tailored for just public health administration program.
Okay, thank you very much. I'm currently preparing my papers, so I'm planning for the next step.
Okay, that's lovely. And also try and look for someone that has either done the same application previously, that have done it, or someone that can mentor you, because you can't do this on your own. And that's the truth. I mean, some people do on their own, but ideally, why should you do on your own if you can find someone, find a group of people, you're working together, you're helping yourselves along as well. Just, yeah, get all those going before the scholarship season come back. Dr. Salifu, you've got your hand up before we continue.
Yeah, sorry, I'm in again.
Thank you.
Just to kind of flag this one, for PhD specifics that are funded, there is a site that is called Find a PhD. It's together. Find PhD. So you could check there, and there's the similar one for Find Master in UK. So these are, subject-specific PhD, public health, what have you, and all the other, subject-specific areas in universities that they have advertised. So you could kind of scan through, just put the subject area or your interest area in the search engine and search. So you find the universities and the courses, the specific scholarship that are available. And that one, mostly, they are fully funded. So you just craft your statement and the preparation, just like I talked about during the first half of the conversation. Then you submit. And just to add to Fola's caution, try to finish them as early as possible, so you give it to people to read through and make correction, grammatical, and other things. Because sometimes it's a bit boring. All of us, we make those mistakes. It's not you alone. Sometimes, sometimes the way we write and the way we speak within our context, Ghana, Nigeria, and elsewhere, maybe it's not acceptable. So just try to push it to the level that is acceptable, so that you communicate clearly to the reader and avoid jargons, other things. Just straight to the point for the person to understand. Because I'm one of the panel members for some of the scholarship. What we try to do is that we want to understand the person's situation. So if you write at a level, or maybe with some kind of words that are very difficult to understand, then you're kind of eliminating yourself in the way. So just take that. So you find find PhD, find masters. There are sites in UK here that you can find the scholarship for specific EADs. Thank you, Fola.
Thank you, Dr. Salifu. Very valuable there. Who? Sammy? No, it's not your turn. I'm sorry, Ayodele, it's not your turn. There are people that have hands up prior. So if you want to speak, please have your hands up and then we'll try and go by the number. So Sammy had his hand up for a while now. Sammy?
Yes, good evening, everyone here from Nigeria. Thank you, Dr. Fola, and all the speakers for your contribution so far. My question goes, what skills, data tools should or would you advise one acquire in preparation for studies in this field of public health? So I know at the end of the day, most of us are going to go into either quantitative or qualitative research during our course of studies. So are there data tools one should have a knowledge of to help one better prepare for studies, and also to keep one abreast of what is happening in the industries for those that might want to go into industries? Are there tools one should learn ahead of time? So that's my question. Thank you.
Okay, thank you very much. So what you mean by tools, I think obviously you're talking about research tools. There are so many of them that you can learn. It depends on, like you said, it depends on your focus, where your research interest and research strength lies. So where you're interested in quantitative, there are so many tools that can be used for quantitative research. For example, you would have R, you would have maybe Python, you would have Stata. It's like the list is endless. And also when it comes to qualitative, which I think is where Dr. Salifu strength really lies, you would have NVivo, you would have a Caucus, you would have I think there are just a lot of them that you can familiarize yourself with. And I think if you're interested in it's not quantitative, sorry. If you're interested in reviews, so systematic reviews, you could have Cochrane, like for example, Cochrane have a tool that you could use for systematic reviews. And yeah, there's just a lot of them. It would depend on what you want and how much you are dedicated to learning some of those tools for what you need. Most time, depending, sometimes you would learn as you go. So it depends on, you're going on in your program and you realize, oh, I do need this tool. Then you would obviously go and learn on that tool to be able to help you get onto whatever else you're doing. So you can learn, definitely you can learn, but it would depend on your area of. So I can't really, I don't know if there's anyone that wants to suggest, but I can't really suggest one for you. Like I've mentioned a few of them, but those are just the ones that are out there, depending on what you want to do with it or where your area of interest and strength lie would also determine which of the tools you finally learn. And I think within PhD, really, when I was doing my PhD, and I think,
can anybody hear Dr. Fola? I couldn't hear. Can anybody hear?
Can anyone hear me?
I can hear her. We hear you, Dr. Fola. I can hear her.
Okay, thank you. I know these network things, they can have a mind of their own sometimes. Thank you. So yeah, you could literally have any of those tools. SPSS may be one of them that you want to learn if you starting from basic in terms of quantitative and just going on. Also, just to mention that if you're in the UK or if you're considering UK, most UK would have some of these tools that you will be able to use. They will have it they would have it as part of their package, so you don't need to pay for that. I mean, R is free, obviously. R is open source, but there are some of these packages like SPSS that the university would have for you to be able to practice and learn. So they have it already in as part of the package you can access as a student of that university. So reviewing all of those would be nice for you to know which one of the packages, which one of the tools would help. Any Thank you. Any outstanding question?
Yes, please. I have a question. Good evening. Thank you so much for this, my please. I've learned a lot. Please, I am going to finish my master's in public health this June. But I want to know what job opportunities are there in England for me. Like, where do what are the steps that I need to do to get the job available?
Whoa, Dr. Salifu, do you want to?
Okay, if you wouldn't mind, I have my girl if she's speaking noise. So with the jobs, it depends on your interest and your specialty. For instance, I'm a nurse both in Ghana and in UK, but I don't practice clinically, and that's a choice. Somebody might, I teach, I love to teach, and I will teach even if I'm going to be paid half of what I would have been receiving if I'm practicing clinically. So there are a lot of factors that comes into career. So you know yourself best, but I'm just trying to give you a generic information. So we have teaching people, academia, industry, and clinical and whatever, and even research councils. But even in academia, some people might want to do, let's say, is it teaching? Is it teaching and research? Keep quiet. Sorry. Teaching and research, or maybe research only. So you need to really pin down where you're interested.
Focus on research, because my first degree, I studied medicine.
Good. So you want a research?
Yes.
Yeah. So if it is a research, then bingo. A lot of opportunities are there for research associate. Whatever.
So how do I apply? Is there like a website? I want to know the inquiries you want. Like, do I do a test?
Yes. So they also have a site. I'm not very sure of the exact name. Either careers in UK or jobs in UK, and you add a specific area. You should see tons of them. Then you try to limit them in terms of sometimes location. It counts. There are some people who want the work in some location, and there are some people too who didn't want a work in some location, like myself. I am a village boy, so I don't like big cities. I don't like big cities. So London, for instance, I wouldn't like working there, whereas for Lion, we like big cities. So it's most of these things are individual, preferences. So you need to factor all these things into the equation. You get it?
Okay. And in terms of visa, it will be work visa, right?
Yes, work visa. And even if you go to the website, there are a lot of work that they classify as essential currently. And even with that, you are not going to pay for immigration health center. That kind of require a lot of money to be paid. For instance, a family of 3 or 5 previously, you could be paying about £15,000 for visa application for about 5 years, including the immigration health center. So you need to check whether it falls under the essential works. And most often than not, you will not be required to pay for the immigration health surcharge.
Okay.
Thank you, Dr. Salifu. Yes.
Thank you so much.
Also, if I can add on to that, yes, it depends on what I mean, Dr. Salifu said everything really, but you should also know. I think if you are interested in research, you can check jobs.ac.uk. So with jobs.ac, yeah, .uk. So they have a lot of research fellow adverts in quantitative, qualitative, So that can be somewhere you can look into for as well in addition. And I also posted jobs in NHS. The NHS do have some research team and department that you may also consider. Maybe if you have a look in those as regard as well, there might actually be something for you to pick up from there.
Thank you so much. Sorry, I have one more question because both me and my sister, she's interested in mental health. Job for her, is it also the same, like the steps?
Is she mental health? Is the person registered?
Yeah. She's a mental health advocate. She also studied medicine as her first degree, and she's also doing master's public health with me.
Yeah. Due to COVID, the ramification of COVID on mental health and other issues, in fact, their roles has become much more important than previously. So there are a lot of works coming in through their adverts. Even if you look at it in nursing, for instance.
I couldn't hear what you were saying.
What I mean is that there are a lot of adverts on works related to mental health. So you may need to check the site that Fola told you about, jobs.ac.uk, and you should definitely find a lot of them.
Okay, I will check it then. Okay.
Fab. Thank you, Dr. Yakubu. Thank you so much. Dr. Olu, do you want to, I don't know, if you want to chip in at any point, please feel free to do so. Who's next? Is it DUK?
Okay. Good evening, everyone.
Good evening.
Good evening. You've been quite a wonderful session so far. Actually, mine is a quick one. I'm trying to look at some schools, but I see the fees are quite steep. I don't know, would you suggest a school that is quite affordable and also has a quality teaching? For instance, your school, so if you have maybe a couple more schools that are on the same cadre that one could look through and maybe make a choice from those ones. But not all those schools that will maybe have me selling my whole family property. Thank you.
Okay, thank you very much. That's quite interesting. You mentioned my school, and I just had to smile because I'm not on this platform. I am independent of my school, so I'm not going to push my school to anyone. So I'm not here to talk about. I joined a space. I think was it on Friday, and it was literally about they were pushing the university. This is not my school university, my school space, so I am not pushing my school to you or anyone else. However, so because I wouldn't want you to come in and you're like, Fola, you said I didn't say anything. Make your choice, please. However, when it comes to schools within UK, right, we do have, I think they are quite, it depends on your interest, really. So there's really no school that I would say is bad, and there's no school that I would say is better than the other. When it comes to financially, or when it comes to tuition, most UK MPH or MSc would really be around 7,000. Sorry, not seven. Don't quote me on that. About 14,000 ish. So roughly around 14 to maybe it could be lower. It could be up to lower, like £12,000, 14,000, 13,000 pounds. Some universities, and this is what I would suggest, many students, many applicants, sorry, make the mistake of just looking at the school and the fee, but there's a lot more that goes on outside that. So a university might be 14,000 pounds compared to a university that is maybe 12,000 pounds, and you're like, oh, 12,000 pounds, this is cheaper. But guess what? You have not actually checked if they are offering discounts. Some university offer discounts based on your qualification. So if you have a good qualification like a 2-1, some university would offer you maybe, I know when I came then, I got 25% discount then. So and it's based on your qualification. Once you have that qualification, it's automatic. Some university even get up to 50%. So you need to consider and look at that if there's opportunity for that before you go for a 12,000 pounds, thinking, oh, this is the cheaper one, right? There's different scholarship, country specific. Nigerian students, African students, they are specific scholarship as well. You need to check all of it in their website and make sure that you add all together. If you can find any scholarship, how much is it, add it to the tuition, and make sure that that is the best one that you're going for based on everything. So don't just look at the fee, don't just look at, oh, this is 15,000 amount, because it might actually be cheaper in the long run if you add whatever scholarship or discount that they have to it. So like I said, when it comes to the actual course, I've run down at the start of this space. I mentioned some courses that you should roughly be expecting in public health. So I would say a school that depend on your interest, right? We talked about the types of the difference between MPH, MSc, and MA in public health. It all depends on so they are different. They sort of like have different strengths, but it also depends on you which one you would be interested in. But I would be expecting a public health program to have like at least one epidemiology and statistics module. I'll be expecting maybe health economics. I'll be expecting maybe health promotion, maybe ethics and law in public health. I will be expecting research method. I will be expecting, yeah, I think this will be policy and leadership in public health. So these will be like the basis that I'll be expecting. If I can see these, I think I'm fine with. I think the program is good enough to an extent for me. But obviously, if you're not interested in other aspects of public health, more specific around maybe digital medicine, there are some courses, there are some schools they will offer you that as a optional course. Then you can also consider that as part of what would help you decide on your you're going to that university. I don't know if I've answered that question.
Yeah, you've done well. Thank you very much.
Thank you. Okay. Dr. Olu, please come on.
Yeah, thank you very much.
Hello, good evening, everyone.
I think you answered the question in a very beautiful way. I just wanted to add some other few things, DUK. And again, this is just my honest, humble opinion. Sometimes also you want to consider the status of the school in terms of what is the school known for, and if you want to try and be very strategic in that sense to choose a school that will position you in terms of job or career prospect, because I'm based in Cape Town, South Africa, and I used to tease some of my friends that look, you honestly speaking, if you look carefully, there are some schools that no matter what, their graduates will always find a job. No matter what, their graduates will always find a job. And it just boils down to networking. The fact that some of these schools, they've already established a very robust, industrial collaboration, industrial networking, and all the rest of them. So you want to also be very strategic in your choice of school. Of course, there are so many other factors that come into to influence that. But yeah, I just said I should chime that in. For the other lady that asked a question about jobs and all the rest of them, it's so interesting because I didn't even notice the space was on when I tweeted something about getting skill. I mean, just on the surface level, all of my degrees are in chemistry. But guess what? Since 2014, when I finished my PhD, I've technically speaking not been in the lab, say, running any chemistry experiment. So what have I been doing? I've been mentoring, coaching, training postgrad students on how to do research. I speak the language of research. I explain the analogy of the processes of research to you in the simplest way possible, because it was something I found out that postgrad students were lacking. And so I took time to develop myself in that area. So, getting a postgrad degree is one thing. Getting a job, your skill set will also set you apart. It will give you, it will serve as a leverage for you. So these are some of the things you want to think carefully. Dr. Fola mentioned all of the tools, analytical tools, instruments that as a public health, you cannot but develop some level of competence on them. You want to talk about statistical analysis, the use of SPSS or startup package and all the rest of it. You need to develop your skill set. You want to talk about data collection instrument. You need to develop your skill set. So these are things that beside the public health, being a data analyst, I promise you, here for instance in South Africa, sometimes students can be paying some. I don't want to mention the price, but you see what some data analysts charge. You be like, is this for real? These are opportunities that you can create and thank you. I yield it, man. Thank you very much for.
Thank you, Dr. Olu. Valuable contribution there. See, like we always say, no one knows all. You would always need to know more and develop yourself and add to yourself and just package yourself, because it all depends on how much you go is how much you will get. Who else is oh, I can see Silas.
Hello, Dr. Fula.
Good evening, sir.
Good evening, Dr. Olu, my family member.
Yes.
Dr. Fola, thank you. I just stumbled on your space now. Never knew it was going on. What a very nice topic. And it got me thinking about my wife. Hopefully, my wife will start her master's in children and mental health in the UK. We're just keeping our fingers crossed very soon. So she has a 5 years experience with working with young people. She's an early year teacher, and we were thinking of going digressing a bit to young people and mental health. So she's applied to 2 schools in the UK to do a Masters of Arts in Mental Health and young people. So my main concern is how would you advise, what is the prospect, how would you advise you navigate through the career route prior to finishing her degree, and what are the job prospect like? I just need your advice so that this is a family thing, so that I can equally direct her and we'll make good decision. Thank you very much.
Thank you so much, sir. I think first of all, because obviously this is mental health and children, young children and young adults. It's something that is very, Dr. Yakubu, I believe, has touched on this earlier. Like it's something that is in the forefront, especially, I mean, it's always been in forefront in the UK to an extent, and now with the COVID wave just sort of like finishing, is even more in the forefront. It depends. I'm not sure I know her background, because if she's a mental health nurse, or if she's a nurse and now trying to do mental health in young adult and, oh sorry, children and young adult, that would really be a really good area for her. And there's a lot. I mean, I always see mental health nurse adverts, like every time I open job search, I would always see mental health nurse advert. So if that's her route, that would definitely be something I would encourage. Anything mental health, I would encourage it. But that would also be, quite easy. Not easy, but like it would be a good career prospect in the UK. Yeah, I don't know what I'm saying. But yeah, it's quite promising in the UK. Like I would say, and this is for anyone, it's not just her or anybody. If you're coming in as an international person to the UK, please, as you're landing and settling, not as you land, but settle first, get yourself together, know what you're doing in your program, know what your program is about, lock your studies in place, and then start hustling how to get local experience. That is just the way to go. So before you're done, you already are involved in one project or the other. You already have one employer on your CV that you have done something with or the other, and that can be what you will leverage on. Because even if you have several, it depends on, but if you have several years of experience outside the UK, you would still need to prove yourself within UK for most employers. So trying to do that immediately as she's entering, she settles down, gets her studies in check, knows what she's doing with her program, of course, because that's primary is very key, that she knows what is going on in her program before she start hustling other aspect. Then immediately after that, please try and get local experiences. Like I said, one place that is also, in addition to so many other places that are online, is to look at um local councils. So whatever school that she's going to, let her check the local council around that place. They would almost always have youth program, and I mean mental health section. It's no given that there will be a mental health section in there for her to key into, even if it's volunteering. I put on my Twitter the other day, a friend of mine did social work and she couldn't seem to get a job because her social work she actually did in Nigeria and then came to the UK for a diploma in it, and she struggled. She did a master's in public health and then a diploma in the social work, and she struggled to get a job because she doesn't have UK experience. So I just advised to her, like, why not? You've been going back and forth sending CVs and no one is calling you back. Why not volunteer for these people? They are employing, that's why you're sending CV. Then if they are employing, that means they will definitely take you for voluntary role. And she did. Once a week, every Thursday, she will go, and they have those projects. She was actually working with young people too. They will have those projects they will do, but it was free for her. She did that less than what, 3 4 months. She used that to get a job. It was an agency job. She got the agency job, and from there, from the agency job, she was able, because the agency job will not give you visa actually, but she used that to get the agency job. She was still on a study visa, and from there she was able to then get a council job. She's now in Somerset. She was able to get Somerset council job, and with that they just gave her 5 years visa straight, like immediately. And because she's social worker, she doesn't, I mean, Dr. Yakubu was saying it, she didn't have to pay for any, IHS, whatever. She didn't pay anything. She didn't pay for visa fees. And all the places that she applied to while she was running around looking for those jobs, guess what? They were actually calling her now. They see her profile and they're like calling her, do you want to come and join it? She asked me one the other time and she was like, oh, this Bournemouth local council is calling me, but I don't want to go back to Bournemouth. I said, are you even considering it? You apply to them, they deny you, and now they are calling you, because they've seen your profile. So anyway, all I'm saying is, immediately she settles in, let her start looking for local experience, even if it's true voluntary, for the start. So hopefully I've answered. Thank you.
Thank you very much, Dr. Fola. In fact, I think 2 good heads are better than 20. Thank you very much. You just give us a professional advice, and we'll work with that. Thank you very much. We're just keeping our fingers crossed for everything to work out fine, and we'll see how it goes. Thank you very much, Doctor.
Thank you so much. And yes, that fingers should remain crossed, because we are all crossing our fingers for you and everybody else coming to the UK. I would always say it, and this is not something I joke with. If you are coming to the UK as an international person, right, and you know your onions and your your ingredients, you will definitely cook a fantastic meal at the end of it all. Meaning you're not lazy. Please don't come and be, you're not lazy. You're ready to learn. You're ready to grind. And I think most of us are. I mean, I know my people, we most of us are. But just to say that, people are like, I'm scared of coming to the UK. Honestly, you don't have to be, if you're ready to roll your sleeves and do what it takes. Yeah. Thank you for that. His badge, something. Sorry if I mispronounced it.
Thank you, Doctor. It's BJ.
Okay, thank you, BJ.
Okay, thank you, ma'am. I'm really grateful I could make it to this space, because it was just like this space was made for me, because I just gained a conditional offer from Glasgow Caledonia University to study masters in public health. So I and I'm really grateful. I've learned a lot about this discourse on this space. So what I'm here to ask is that, though I joined late, maybe you have talked about it earlier, I don't know. Or what I want to ask is that, is there any like in these schools, is there any deposit, tuition deposit to make in most schools in the UK? Because in my course, like you said earlier, they give me like £2,000 discount in the course, and I don't know whether I'm going to pay the rest fully at once. So that's my question right now.
Okay, thank you. First of all, congratulations on your admission. It's not easy. So that's a good one. Congratulations. Hopefully everything goes according to plan from here on. Now, like you said, they will definitely have, I mean, most schools in the UK, they have two ways of paying. The first one is full, so you pay in full. Where whatever the amount is for your tuition, you pay everything in full. Most time they do that, but they would expect that you sorry, they will give you about I think it's around, it depends. Some will give you around 5% once you pay in full. So that's one way of payment. Obviously, not everyone can afford such. And so there's the other option, which is for you to pay some instrumental. Now, the instrumental rate depends on the university, to be honest. It, it, it depends. Some university would expect like about 50% before you come in. Some people would expect maybe I think most people students sorry, most university would be roughly around 50, roughly 40-50% ish kind of before you can come in to start the program. Now what happens is after that there are some university, I'm not really sure. I can't speak specifically for Glasgow. I'm trying to pull out their information. I can see their fee is about £14,500. So with 2,000 off it, that will give you about £12,000. They will not, there's no university that will compulsory that will make it compulsory for you to pay in full. That you can take it off. You will definitely have the instrumental option. But what the instrument would be is what I'm not sure of. Some of them would have you pay about 50% of it as you come in, and then the rest they will split it. There's one university, I posted it on my Twitter handle the other day. They actually would give you 50 about 10, roughly 8 to 9% every month until the end of the fee is paid. So that one you are having about 6, 7, 8 or 9 times for you to pay up. But most universities that I know, they would expect that you pay about 2 times after you come in. So say for example you've paid 50%. When you come in, you would then pay another maybe half of it. So the whatever 50% is left, they will split it and ask you to pay half. And then about 3 months or so after, you paid another the rest of whatever is left on that part. And some universities, so that's if they split it into two. Some university, after you pay whatever you pay before you come in, some university, I know T side is about £4,000 you pay, and then you come in, and then you pay the rest in maybe installment of 2, 3. Wolverhampton is the same. You pay about almost 50% before you come in, and the rest is about 3 times to for you to pay the rest of the installment. So I would mostly that's how it goes. Some of them, like I said, would allow you to pay monthly. You can, that's once you come in, you can then set up a monthly payment plan with them. I would suggest where you're struggling. This one is, so I can't overemphasize this. If you're struggling, please go to the finance team. Don't let them come to you. And I'm saying this because I've seen a colleague. I was actually doing PhD while he was doing PhD. I was on scholarship. He wasn't. He's paid about 2 years, and unfortunately, he was struggling with the rest of the payment. And somehow, I don't know what happened with the with communication, but something happened and he was actually withdrawn from his PhD. And guess what? He paid the he paid the outstanding fee on Friday, and he got the withdrawal letter on Monday. and they didn't pay him back. They did not give him back his money, and he did not get his PhD. He had to go back to Nigeria and then go to I think he went to Sheffield Hallam University, because he still wanted to come back to UK. But the years and the money that he spent in that uni was gone. So if you're struggling financially during your program, don't wait. Run to them before they come to you, because sometimes they just head on and send you to home office and they withdraw you, and that's it. So and also please do check the Glasgow Caledonia School payment plan itself. I'm trying to pull it up, but because I'm on space now, I can't really focus on pulling it. But they will definitely have installmental plan. If you check, you will find it. Thank
you
you.
very much, ma. I will surely chat them up tomorrow morning to know the next step, and everything will go on from there. Thank you very much. This really helps. Thank you.
Okay, thank you. Fab. I think it's Ayodele.
All right. Dr. Fala, good evening.
Good evening.
Hello, can you hear me?
Yes, we can.
Oh, thank you for all you do. Messages, you direct message, and
you're not very clear, unfortunately.
Hello, can you hear me?
Okay, yes, we can now.
Okay, so I want to appreciate you for all you do.
Thank you, sir.
And what I just want to ask is that as an international student in UK, are there opportunities for tuition loan? And then if there are opportunities for tuition loan, I think for international students to take up the tuition loan, so that's what
Okay. Wow. I've tried to pick your question because the network was breaking quite a lot. But I think what I got from your question is that, are there opportunities for tuition loans for international students in the UK? The short answer will be no. Most most loan companies would expect that you're in the UK as a resident. So what they do normally is, first of all, if you're a home student, so that means you're registered UK student, you are entitled, or you can easily get a student study loan. Also, I think there are some government program for home student as well, to be able to study their masters or postgraduate program, depending on which one. But for international students, you can get, if you're residents in the UK. So that means you've been in the UK, I think, for like 5 years. Then there are some companies that are open to you, or they are open for you to get those loans. The other thing, there was one I came across, and I put it on my Twitter timeline the other day. I can't remember the name, to be honest. I would advise that you please go and search my Twitter space and check for loans. I saw that one. It was interesting because they did say they can offer, irrespective of your status, whether you're international or UK student. So I'm not really sure if that, but they did say on that, in that in their on their website that I saw. So I would suggest maybe you should try and check them out. I honestly can't remember the name, except if you ask me privately, maybe I will search it and send it to you again. Or you could just check on my timeline. You should be able to see that. But yeah, there are definitely loan companies, companies that will give you loan, but depending on, for international students is slim. But I saw that one. I was surprised when I saw it, and it says, even as international student, and I thought, wow, even if it's not residents in the UK, okay, that's interesting. So maybe, yeah, you can check them out. I can't remember their name. Sorry. Priscilla, you've got your hand up.
Yes. Hello.
Good day. Good. Yeah.
Yes.
Good day.
Okay. As regards that DCU, that's I've got so then they have several instrumental plan.
Okay, 7 instrumental plan. After what you were breaking? Can you say that again?
Yes, I said their tuition deposit is £4,000. Then 7 instrumental plan.
Right.
Thank you.
Okay, so that's fab. That's actually, yeah. So hopefully, I don't know. I think it was HB,
Yes,
HB. I think. Yeah.
It's
Yeah.
BJ. It's BJ. I'm here.
Okay, BJ. Yeah. So that's an answer for you.
Okay, it's 4,000 deposit, right?
Yeah, and
Yes.
then 7 instrumental.
God bless you. Thank you very much. I really appreciate that.
Okay.
But you must set up the plan before you get.
Yeah. So they would ask that you submit a what's it called now? What's the name of that thing? A card. Yeah. They would ask that you submit a card so that they can but honestly that can be changed if you get in and you could submit a card and you get into the country and you're like, oh, I have other means of payment. They will take it. What they just want to know is that there is a payment that they can pull out when it's needed.
Okay, thank you.
Okay, Priscilla, have you got your own question or are we good?
I'm good, thank you.
Okay, fab. Thank you very much. When it comes to, I think I've mentioned this earlier that when it comes to public health schools, the only school that I know right now that offer full placement of year-long placement is, I might be wrong, if there's anyone that know any different, please let me know, is Teesside University. They offer full year-long placement or the option of it. But I think with those schools, with such a school, they would most likely not, because I know someone who is doing engineering right now in Teesside, and he wasn't offered placement. Like they wouldn't help you get placements. UK schools don't go around help you get placement. They may give you the letter, but you would have to source out the employers yourself. And if you find, that's good. If you don't find, well, it is what it is. So but Teesside is actually quite a good one. However, they do have a lot of applicants. It's like they are choked with applications. From Nigeria alone, someone that tried coming in last year with them was about 1,000 or so cars was processed. So about 1,000 people just from Nigeria. I mean, it's ridiculous how many people apply to them. So they struggle to get cars out for students as well because of that much this thing, that much applicants from Nigeria and also other countries. And also their payment is, you can pay if you have 2 years plan. You can pay, which their public health is, you can pay over 2 years rather than a year, that most schools would expect you to pay 13,000-14,000 or ish pounds. So that would also be just something to consider if you're interested in looking at some of these universities. But like we've said previously, with scholarship, and I think Dr. Yakubu really highlighted a lot on preparing for scholarship and getting yourself ready. Scholarships right now for masters are not really open. Most of them are closed right now. So just keep an eye out, and once the scholarships are coming in, the openings are coming up, you can start putting in your application. Who knows, you can get scholarship and all these fees are waived, completely waived, or and you probably even get paid in addition to that. But that's just something for you to also put in mind and think about. Okay, is there any question, comment, addition that we may have from any of our speakers, or any
Sorry,
question?
I have a question.
Yes, please.
Okay, Ibikolo is my name.
Hi, Ibikolo.
Thank you very much for this space. I've learned a lot from what has been discussed. My own question. I have a MSc in epidemiology from UI. Currently waiting for my transcript. Well, my question is tailored towards finding PhD in the UK, because my search generally was maybe a PhD in epidemiology, but I found out that I didn't get a lot of options. So I delved into streamlining it into my research focus, which is into mental health topic because my MSc thesis was on mental health. Was mental health related, and I have a work published already and the second one on the way. But man, I want to seek for an advice that should my because when I search based on my research focus, which is on mental health, I got scholarships, but they are they are in social sciences, maybe like psychology, sociology, and the rest. I didn't really get one that is in epidemiology that is related to mental health. So part of why I joined this is that maybe I will get more like an idea of how I can make a search that might link epidemiology to mental health in any of the search and I get online. So that's my question. Thank you very much.
Okay, thank you so much for that. Dr. Yakubu, do you want to handle this one first?
Yeah, probably a quick one. So, first of all, what I want to tell all listeners is that you need to be very resilient and be very, endearing, trying over and over. Because usually, if you look at the slot for the scholarship, a lot of thousands of people, do apply. Just few people get it. So sometimes even rejecting you does not necessarily mean that just that maybe they are expensive. So that's one. So do try a lot of universities. The person who just asked the question, which epidemiology, I'm not trying to project my university here. Do check at Lancaster University, the medical school and the Division of Health Research. I know they do a lot of fantastic epidemiological work. And just one word of caution, sometimes we need to be a bit lazy with our stand to get a scholarship, because most of the PhDs are, the fundings are weaved around some interest within universities and also by the funders. So you may not necessarily get a funding that is directly related to your topic. Sometimes it may be very close, or maybe you may have the topic interest, and they say that the study need to be done in the UK, and maybe you want it to be done in Sierra Leone. To me, I don't think it matters so much, because the outcome of the work be applicable, within different contexts. So try to be a bit, accommodating, compromising on some of the things so that you get the scholarship. For instance, I have a nursing background, and I have 3 supervisors. One was a nurse, and later on she left, and I have to deal with 2 sociologists, and nothing really changed back. But even I thank God that happened, because I've had a lot of sociological insight into my PhD as well. So sometimes some things, when you are pulling certain things and it's not coming, it may also be, in your own interest. Try to be a bit adaptive. Look at other areas. And for a PhD, I do tell some of my, a lot of my students, when you get your certificates, apart from the thesis and other, that is it. There is nothing that you've been admitted in a PhD in School of Health Science, and that's all. So sometimes I do tell my student, if only it is a subject area or maybe some aspect of interest, you try to be a bit, updated, because we will not tell you, maybe PhD in public health, waste management on your certificate. Most universities don't do that. The bottom line is that even the PhD in itself is a training, so that after you've attained your PhD, you can now, zoom into the research arena and do a lot of research. So that is my advice to a lot of people. Once you try to be a bit accommodative, you will get a lot of options. So it's a caution to people note. Thank you.
Thank you, Dr. Yakubu. Absolutely. Can I just quickly also add on to what Dr. Yakubu has said? When it comes to epidemiology, I would say try and search for what's it called, PhD in public health. So if you can see any PhD in public health or PhD in mental health, since it seems you're interested a little bit in mental health, you can always pull in epidemiology as your research method. So using, your quantitative skills to execute whatever that project is. But it's very difficult for you to find the specific title, the area, especially when you're combining different, you're looking for epidemiology, you're looking for mental health. There might not be a project that will fit both requirement. There are some universities, there are some scholarship options, but not so many of them. I know there's one in Bournemouth University. They actually have funding, and the funding is also stipend is included. So you have tuition and stipend, and they allow you to write your research proposal in any area of research. So if you have those kind of scholarship, then you're free to, write and design your proposal. And I do hope you have your proposal ready or almost ready for you to submit if you do find any suitable scholarship of that nature. So, but those are not very common. Most times you would have those ones that are funded. They would mostly be those ones that you would have to work to make some compromise. Like when I was applying for mine, I realized that I needed to do my project in the UK. I would have loved to do it outside the UK, which is in my home country in Nigeria, but I realized the funding would expect me to do in the UK. And so I had to write my proposal to say I'm going to be working with Africans in the UK instead of Africans in Africa. I had to make that compromise to be able to get that funding. So you might also tweak some things if you don't have that luxury of submit whatever proposal. Some scholarship have that and some don't. And I would also suggest you check, Dr. Salifu mentioned it earlier, check, find a PhD. I believe that's the website. And also jobs.ac.uk. They do have some PhD adverts that you can work with as well.
Yeah, just to add one more sentence to that. Most of the PhD, we peg the supervisors based on several factors. So a method can be one of the one of the areas. So if you are looking at epidemiology, maybe I'm not epidemiologist, so they may bring somebody who has that expertise in epidemiology. Maybe the work is in African context, and I may have a lot of knowledge there. I can be on board, and maybe the subject is, you can get somebody also having what do you call it, an area there, or sometimes even a method that you're going to use, whether qualitative, quantitative, SPSS, whatever, regression, grounded theory. They bring all these things together. So do not worry too much. Once you're able to carve some things out, sometimes we bring a lot of people on board so that each of them will be able to contribute to your PhD journey. Thank you very much.
Thank you. Thank you, Dr. Yakubu. Olajide, thank you for joining us.
Thank you very much, Dr. Fola, for the opportunity. I'm seeing some familiar faces, the speakers, and I acknowledge you all. And, thank you for pushing, the front from the public health aspect. I just wanted to stay in the listener section just to listen to, the discussion. Although I'm an engineer and, reside in Canada here, and I realized that, I have an information that will be very vital for people who are especially looking for for opportunities in the field of public health. Not only public health, if you are in the field of public health, if you are in cancer research, biochemistry, community health, pediatric, clinical science, microbiology, virology, anything related to health sciences, I want you to listen attentively to this very important information. So just last year, in different countries all over the world, it's most times government, bodies fund research. It's not like where we come from, Africa, where if you want to do your bachelor's project, the supervisor will tell you, oh, go and, you're going to do this project. So what you have to do is to go back to your parents or you find money to do your research, right?
It doesn't work here that way because most projects are geared to solve a particular problem in the society. And so you see researchers, they will write proposals to the government to get money. And what do? They are going to hire graduate students like you and I to come do the research, right? So that is how these things work in the West. So just early this year, there's an institution or there's a government institution for health research here in Canada. It is called Canada Institute of Health Research. So it's the body that administers funding to professors to do research and also hire graduate students, buy equipment and all those things. So this body, they provided funding to over 400 professors. I repeat that, over 400 professors in Canada. And each professors were getting up to $500,000, $700,000 in different universities in Alberta, in McMaster, McGill, in Dalhousie, a lot of universities all over Canada. So they released that information. It's a publicly available information, right? So on that website, you will find the professor that got the money. You see the name, you see the title of the project they got the money from. There will be a short abstract of the project they want to work on. Now, these are publicly involved. They are not hidden from anybody. Now, as a student, who is very talented, looking for graduate opportunities, what will you do? You see that information, you take advantage of it. You go to the professor's website or their Google Scholar, you see if they have been working in that project, in the previous years, right? Something related, because, researchers always continue, on a particular project. When they get results, they apply for more funding, they go on like that and like that. So you check the information, you check their papers. Oh, this project that they advertise that they got new money from, they've been working on it in their research. Okay, then you read their papers. What do? With the information you get from this website I'm talking about and their previous work, you construct a cold email. And you do what? You read their papers, you do everything, you align your research interests, even though that thing doesn't really interest you. But as long as you have some experiences in that area, or even if you don't have experiences, if you have transferable skills, you understand how to do it, with the research methodology, you know how to use certain tools. So you align yourself to that project because you found that information. You align yourself to that project title and abstract that you find on that public website. You will now code email so that when the professor sees your CV and the code email, they'll be like, is this person in my head? Do they know? How do they know that I'm trying to work on this area? This is a very perfect candidate I'm looking for. And what do? They'll say, okay, let's set up a Zoom meeting and let's discuss because I'm actually looking for a for a student to work on this topic. But it doesn't mean that when you contact them, you say, hey, professor, I'm so, I'm Ibikunle, always here, I'm Agbakin. I saw that you just got money on the so website. You just cashed out. $1 million from the government. And so I'm looking for opportunity to jump. I want to run away. I know you have the money. Please give me $50,000 to come and do graduate research. That will never work, right? That doesn't make sense at all. So that's entitlement in that situation, and they won't take you serious. So what you want to do is you want to position yourself. You want to use that information to your advantage. Please, the project abstract and the project title you will find on this website. Don't copy it and say, I want to work in so area. They know what they submitted to the government. So they will get an idea that you've seen that information somewhere and you've copied it directly and you sent it as an email to them. These people are not fool. They are going to tweak it in such a way that it's going to mirror everything that you find on that website so that you say, okay, yes, I want this student to join me. And that is how you get funding to do your graduate research in Canada. I'm a pro scholarship, and these are the tricks I've been sharing on my page. People want to do in sciences, in social sciences, in law, in health research. So this is how you do it. If you know where the money is, you follow the money. Find the information. Where is this information? Follow the news. Who just got money? Who just got grants? And you align yourself accordingly to that information. That is how you get research, okay? That is how you find out if someone has research grant, even when it is not publicly advertised, right? So like I always say, work strategically, and you always find funding. There is always funding everywhere. In each country all over the world, this type of information I shared are also available in the UK. I know UK has a website where they share all this information for supervisors, professors who just got grants. Same thing in the United States. There is a special website like that. Same thing like that. if Dr. Fola gives me the opportunity, I'm going to share the tweet to this all this thing I just said right now. I'm going to share a tweet in the jumbotron so everybody can look at it, take advantage. 400 professors got money recently, and I'm sure the money is huge, and they'll be looking for a student. A professor getting $1 million, so the project can span over 3 years, and each year they might want to bring in 3 new graduate students and spend, let's say, over their scholarship for over 3 or 4 years. Maybe it's masters 2 years, PhD 3 years. They want to spend $50,000 or $100,000. It's a lot of money. So please, it's government money. Align yourself properly and take advantage. Build yourself professionally and get do something good for your career. I wish everyone the best. Thank you, Dr. Fon.
Thank you so much. That was fantastic. Look at gems and opportunities just flying around. Thank you, thank you. I really appreciate that. And please do add the tweet. I'm sure so many people would find value in it. Chase it up. I received, just like you said, I received some very interesting cold emails in my university inbox. First of all, I don't even know how people find me because, like I said, I'm doing this away from my university. I try not to put my university in any of my, at least I try, but somehow people find me. They find my university email, and they send me some cold email. God, they are cold. Yeah, I think that's just it. Those emails are cold. Like, they don't even excite you in any way. They don't want you don't even want to read it any further. They are just bland. Like, hi Dr. Fola, I'm interested in collaboration with you. I would look forward to working with you. Thank you. And I'm thinking, to do what? What am I supposed to do with this? So where someone has funding, you need to tell them, you need to show them that they need to spend, or they should spend that money on you. And obviously it's a lot of money they are spending. They are actually spending their money that they worked hard to get. Do you know what it takes to get funding? I think Dr. Yakubu, he's here, he will tell you what it takes to get funding in under your belt. It's a lot of work. It's a lot of writing, application, rejection, endlessly, that we have to fight with. And most of us are doing our regular job in terms of your teaching. You have classes, you have supervision, and you are also struggling to bid for funding. And so where I managed to secure some type of funding, and I want to pick up or take on a PhD applicant or research assistant, and you're sending me a cold email to say, hi Dr. Fola, I'm very excited to send this email. I would like to collaborate with you. Do you think I will even look at it twice? I'm not even, like, I won't even respond, because it's not worth me responding. So for you to get an audience, you have to present yourself in such a way that you know what you're doing. You've researched the person, like Olajide said. You have gone into their profile, you check out their publication, you link yourself with their work, you advertise yourself. These are, I can do this, I have these skills, I can use this method, I can do this research, I can package it. I also need your support. I would like to grow under your supervision or under your mentorship, write something that the person will be happy to read, and then request for a Zoom or whatever virtual meeting that the case may be. So just to put on that one as well. Thank you so much, Olajide. Fantastic. Olu? Dr. Olu. Thank you. Yeah.
Don't worry, before I make my big comment, I want to you don't mind, but just laughing. And I'm so anyway, thank you again. This is a very sometimes if people are taking free resourceful information that reach to them free of charge, I hope, I pray that people are taking, and I'm glad also that Honestly, friends, colleagues, this is honest. This we can't do it beginning to the end. We tell you what to do. So let me quickly is, and I'm making reference specifically to the beautiful, amazing information that they just. But when you approach this, do not have any, do not display anything. This will not anything. They do not owe you a single cent. Any entitlement you do is to keep it to yourself. Why? These people are so psychologists, they can read the. So whether you are displaying the sense of opportunity in a passively aggressive ever form that you think by hiding it all, they will see it. Please, when you go to them, some who is who knows he or she wants to do and is ready to take the challenge. In most cases, assessment is strictly based on can this person fulfill the funding of it, and he or she communicates at the time. Can he or she elaborate on just giving relatable examples? These are the things they want to see. And again, you must remember, yes, have your user, have your. Why do you think they want? Why do you think they want to see your writing? They want to see how you present. After they want to see if you are charged and receive. These are things they want to see because one of the money they have, you are to get best out there. So they are not going to send you in training school, English training school, IT, how to read. Oh, develop yourself. Develop yourself accordingly. And the last point that I just mentioned, when you look at this beautiful information Nigeria has just 400, I promise you, three quarter of those people, if not, probably do not to LinkedIn, Twitter, any of these public platform to announce that hey, money need you. So you digging in is very key. You have the most important information. The names of the people. Go. I'm not surprised that last day sent email. As many people who know what to do. All you just need is someone's name, and you start digging. You will always get information either through the applications or the investigator, the email will. So, yeah, like I always say, the best wishes. Thank you.
Thank you so much, Dr. Olu. See? Gems dropping. Olajide, have you got something for us? Thank you.
Thank you very much. I always like Dr. Olu. You know, he always sends best wishes to us. So that's the way he signs out. Yeah. Sorry, I just want to, I shared something in the Jumbotron. Sorry, the information I shared was the one from last year, so that can be an old information. The recent one, which is 2022, over 417 professors got funded, and they got $325 million. So 417 professors means 417 grants, 417 different projects which you can plug yourself into. 325 million, that's a huge money, lots of money. So when you want to reach out, use this information, align yourself. Don't say, hey, I want to work on a project to do something public health in one community in Adamawa. It's government money, as you can see. They want to use it to better their community. And so you should align yourself properly along that line. Don't say, the whatever you want to do, you want to bring it back to your own country. Nobody cares, right? So you are the one looking for the money. They have the money. Compromise along with what the information you are out there. And I believe that you can get something, a funded opportunity specifically in Canada. I wish you all the best, everyone.
Thank you so much for that, Olajide. Really useful. And please, I mean, I don't even need to add on to what he said. Just follow this money, follow the money. Anyway, I although this whole conversation started with UK because I am in UK, but just follow the money. I don't care where you go. You go to Canada, you go to Jamaica, you go to China, just follow the money. So long as the money is there, please go and get it. Don't be some people have their mindset on what certain country, I don't know. I mean, obviously, if you have other reasons, maybe you have family in a country or you have your partner or something maybe, but outside that, please just be open and be free to move so long as the money is calling. I mean, Dr. Yakubu was saying earlier that he doesn't like loud or noisy environments like I am. I'm in London, and I also don't like it because I used to be in Beaumont, right? And I don't like it. Beaumont is quiet, it's calm, so I like it there. But I had to follow the money. Oh. When the money was calling me from London,
That's funny, yeah.
I had to.
So I like the term. I'll be following.
Yeah, so I had to follow the money. I packed my bag. I got my first job. It was in London. I was considering like, oh, if I just wait a bit, maybe I'll get another one, maybe outside London. And then I got the next job. It was in London again. I thought, okay, no, this time, I mean, who gets two jobs? And I had to choose one of them. I was like, okay, no, I have to go with the money. So please don't limit yourself to it has to be UK or it has to be Canada or it has to be Australia or it has to be Jamaica or somewhere. Just follow the money, get the funding. Once you get the funding, you most likely would, get your certificate and you can then travel around the world, go settle wherever. If I'm to choose where I want to stay, I probably wouldn't choose UK right now, like nothing restricting me. It probably wouldn't be UK that would be my top choice. But I'm here because the money is here. My name is on some salary every month is there. So I'm here sitting with it. If it moves, I will move and follow it to somewhere else. So follow the money, not just in terms of you as a postgraduate scholar. Follow the money even after you start working, obviously considering family and the rest of that, but try and not limit yourself to one country is all I'm saying. Thank you. Okay, Mr. Silas.
Thank you, Dr. Fola. Very apt advice. Like I always tell people that kill things, of course, three predominant places are my potential Bradley, United Kingdom, US, Canada. The truth is that this place, people play with good. So it is high time to spend their 10 that is just the truth. You might not lucky to be in Canada or UK or the US. Yeah, I will always use myself as a very case. But I never I'll be in Barcelona. I just stumbled on this scholarship I'm currently on. I on the scholarship Barcelona and this is that the money is equally great. Yes, the money is equally great because I don't have to bother about working at the moment here because I every month I get my stipend even before 28 or 27 of the month, and with that I completely take care of myself and take care of my family back home. So it is not necessarily the US or Canada. Yeah, just if there are secret money somewhere that some people don't. That's just the truth. You go to countries like Belgium. Belgium pays very well. Germany pays like mad. That's so people could use this other country as a springboard to advance to where they want to be in the future. I have a friend, he was telling me his story. We were chat all years, but I never knew that this guy has hustling to be in Canada past 4 years. And the Canadian embassy don't chop money for the past 4 years. Happy they don't check every day. And nobody advised that I had done. And with one guy currently in the UK in London for his master's degree. So it is crazy, but people need to get more sense because somebody was on my ear after the days with some I think so, and the guy was I just international scholarship, which one was, and went on Canada. I say Canada, and you apply for visa project and rejected. You've not asked why you were rejected the first one, and you don't apply for that one. I say why they rejected it already. Try to know why they rejected it. And if you don't find out, they are likely to reject you again. So I advised him you could look for other places. The less travel route. That's what I call it, the less travel route. So I think I potential grad student the best. There are scholarship. I've put some scholarship in Czech Republic, in Prague, very like, scholarship in media and communication studies, photography and likes. So people could explore that, don't necessarily be at the moment because people with travel they you're not competitive and strong, and God's grace, of course, they'll just pick that up. Thank you very much.
Thank you so much for that addition. Absolutely. There are countries that are not the top. I think the UK, Canada, Australia, they like is like that's like on everyone's list. And there's nothing bad in having those on your list, but don't just have those on your list is what we're saying. There are countries that can help you get to those UK, Canada if that's where you want to eventually be. You might just have to have a stopover and then go on to your destination eventually, but try and think about that. I think when you're think about it like when you're getting a flight ticket, when you go for a direct flight, sometimes it's like £1,000. I'm like, what? And then you see a stopover of maybe 2 hours stopover, 3 hours, and you think before your plane land, before you check out, before you check back in, almost 3 hours is almost done. You barely would sit down before it's like they start calling you to come back for your for your next flight. And so if you think about, and that would be way cheaper, like maybe for almost half of the direct flights type of thing. So if you look at it from that route, it's just a stopover, very short minute. Think about it that way. Go and get your funding, and then you move on to the destination that you may have in mind from the get-go. And sometimes that destination would actually change. You are in maybe Spain and you're like, wow, I like the sun, I like the people, I like the environment. What am I even thinking about going to UK? UK is always raining. Like UK weather is the worst. What am I going to do in UK? And then you head on where you want to head on. Okay. Mr. Aaron, please come and join us. I'm so happy you managed to join us.
Yes, I literally just woke up and I saw that the space was going. I'm like, okay, let me jump in quickly if it's not ending.
Thank you so much.
Thanks for holding this. I'm actually to just talk about a few things.
Please go on. The floor is yours, sir.
Okay, yeah. So just to touch on, to build from what the place of following the money, and recently we hosted a space with Dr. Tosin. I can see him in the listeners. And one of the myths, especially for Australia. You've mentioned Australia, but a lot of people don't think here, and that's why we had to hold that space. And thinking about all of those myths, people say Australia is very far. That was one of the things. So I'm like, as we definitely say with Dr. Tosi, it's like, are you going to use a bike to come here? You're trekking to Australia, And so, yeah, these are some of the myths. So it's important that one, just like everybody else, please follow the money. I remember I was applying for my own PhD. I did my master's in the UK that was funded by Commonwealth. And when I was looking out for PhD, I always say, I hated math. Math was always something I failed dedicatedly. So I didn't know how to write. I was scared of writing GRE. So I didn't look at the US. I didn't even know Canada was there, I was just focusing on UK. I got a lot of admissions there, but the Commonwealth didn't fund me. And then just on the UK website, I saw the scholarship in Australia. Just casually applied because, where is Australia? I didn't even know this place like everyone else. And out of like the 9 PhDs I applied, only one worked. And this is only Australia. And then I'm here. The money has brought me here, and I'm saying, I can hear Silas saying when he was mentioning that every 20th of the month he gets his pay.
please, if you are thinking like I will always market Australia with us, here we don't even wait till 28. We get our pay every 2 weeks. So just follow the money and come here too. Because here we get paid every 2 weeks. So yeah, it's very. You see, and aside that, if you think of Canada, Canada is very cold. UK is very cold. London, I say, is very noisy. Australia is beautiful. I don't know why you guys don't want to come here. So enough of my marketing anyway. Now, just to touch on after the space, because this is kind of like a public health thing. After the space we held a few days back about Australia, someone reached out to me, my dear, and said, "Oh, can somebody in sociology go on to do public health?" And just thinking of it, that some people might benefit some people. My response is yes, you can, because it will rely on what your job experience is, or maybe the volunteering experience or the professional background you come from, or maybe your interest. And you're able to sell yourself. I'm sure they've talked about essays. I've heard them talking about emailing professors. Apologies if some of the things I'm saying are repetitive because I've just joined. So yes, you are able to do that switch if your job experience and some of the passion you have speaks to that. Interestingly, my public health, Dr. Fola, she does a lot of magic with numbers. Dr. Tosin, who is also in the listeners, they do a lot of magic with numbers and all of that. But my field of public health was health promotion. So when Dr. Fola and Dr. Tosin are discussing issues, for instance, around 1,000,000 people, and they're talking R and data, I don't even have a clue what they are talking about. But we're in the same field of public health. I try to even not talk about those things. So my public health, which I did in Lisbon University, was the health promotion bit of public health. So we were looking at more into for instance, the social aspect of health. So most of the models we drew on were in the field of, for instance, sociology, psychology, and all of that. In fact, interestingly, my PhD currently is in the School of Public and Social Work that I'm doing in the field of HIV and disability. But the theoretical framework underpinning my entire work was brought together by a sociologist. So I am in public health, but I'm trying I am affiliated to the Center of Justice in my school, but I am still, because my work in public health try to speak to some of those aspects of justice, social justice, inequalities, and all of that. So yes, if you are listening or you are in some field that you feel, I'm thinking of public health, you work with NGOs or organizations like myself, yes, you can. All you need to prove is to show very strongly your passion in your essays, in your SOP if you're applying for scholarships. And yes, somehow I'm sure, I'm confident that will get you there. So I haven't, that thing just resonated with me when I came here. I'm like, oh yeah, there might be somebody who is listening, or somebody who is not here but might benefit from this. So I thought I could just throw that out. So thank you for giving me the floor to speak and for organizing this space. And thanks to everyone who has spoken before I joined. Thanks.
Thank you, my able scholar. So I actually requested Aaron to join me in this space because he's in public health and I know he has valuable and tons of information to share. Obviously, this space started out and we have talked quite a bit around public health. Actually, before you joined us, we did go. So we started from public health and now we are into graduate schools and the conversation around getting funding and the rest of that. So I'm so happy that you're here because I really wanted to host this with you actually. But unfortunately, because of our time difference, I didn't arrange it as I should. So I didn't think you'd be here. So you being here is really I'm just happy about it. And we are definitely going to have one with well planned out time. Definitely going to have one because I think there was a lot of public there were probably there still are, I'm not sure, but there were a lot of public health several public health questions that I've tried to address, but I think you would have actually had a lot more to add on for applicants as well, or potential applicants. So just to add on that, while we've talked about follow the money and follow the money, I think one place that you can start, anyone that is interested in follow the money, is to please follow the speakers. when you follow the speakers, you are on your journey to follow the money, right? Because everyone here is either posting how to get funding, where to get funding, what to do to get funding, who to meet to get funding, where, just those information that can carry you through. When I was applying for my PhD funding, I didn't even know there was I didn't even know Twitter, let alone know that there's anyone I can access on any of these social media platforms. So please start by following the speakers for you to follow the money, and then get yourself down to wherever the funding is that they are posting every day on their timeline. Okay, any further question? Agbaki, I added you to please come on, because I just feel you would definitely have something to give us on this platform. Would you mind adding something to us?
Okay, thank you very much, Doctor. Yeah, thank you very much, Dr. Fola. I really appreciate you. Yeah, I will want to come in a different perspective, away from the admission, away from the job, away from the career prospect. Like many speakers have said in the beginning, yeah, you really do not need to be so focused on a particular research topic, even though you say, okay, probably public health is in your interest. It may not be directly, maybe MSc in public health or PhD in public health. There are always quoted research interests that has some very great similarities with the so-called public health also. But if you are so fixated on looking for anything related to public health, you really may not get what you want. And again, I would like to put this into note also. Like Dr. Yakub said earlier, when you are applying, the fact that you are yet to get a yes after so many years of putting in effort doesn't mean that you really are not good enough. It just may mean perhaps possibly maybe there's just somebody out there who is just probably with some little edge ahead of you, and because of that you are not able to get it. You may have been looking for scholarship opportunity for 1 year, 2 years, 3 years, 4 years, and at a particular point in time you think maybe scholarship actually not for you. I would like to tell you and encourage you that no, it is far away from that. Perhaps it just means maybe your time is yet to come with some little bit of perseverance. Definitely will. One thing I will always advise is while you are looking for the scholarship per se, don't let all your mind be fixated on only scholarship. Don't let it be that probably the only thing you will be using your life to do money on and night will be for the scholarship pursuit alone. If you are doing that, you will be worn out so very fast. You will be worn out very fast. So try as much as possible to keep adding some little impact. Try as much as possible to keep doing one thing or the other that will always make your previous application, your next application rather, to be better than your previous application. And yeah, try to have a very tender community. When I say very tender community, you really do not need the so-called scholars all the time for their direction. Writing SOP, writing scholarship application doesn't mean that until a scholar has helped you review your application, that is when it is so best. When you have group of friends whom you are working together, they are high. They may even have a very sharp eye at looking at all these your errors, your scholars who are a little bit busy, who may probably want to look at the essay and probably in 1 or 2 minutes they say, okay, go and do this, go and do that. Always have a community who you can encourage yourself, you can keep pushing yourself to the best, and it doesn't necessarily mean it will happen once. That your friend got it once doesn't mean you get it once. And does your friend get it probably after some few months of trying doesn't mean you will do. Your own may be a little bit late, may be a little bit early, but trust me, it will happen. Everybody has talked very well, and even though I'm not in the public health sector, I feel I am here to learn until Dr. Fola brought me in as a speaker. I just want to keep listening and perhaps keep learning from the master. Thank you very much for hosting this space, Doctor. You are doing very well.
Thank you so much, Agwaki. I just know you have something that you would add to us. We, irrespective of public health or not. I think, yes, I just know you would add something to us, and thank you for adding that. Olajide, do you want to?
Yes, Doc, I just want to quickly chime in for people who are listening. We should also, like we said, that people should keep an eye on, not so popular countries. There's this scholarship, because I'm pro scholarship, so I believe people should study, for free. Someone should be able to pay, for their education, especially if it's an international, education. People should keep an eye also on, public health programs, in the Caribbean. People, in West Indies, in Jamaica. I have friends, and I've seen people who went there with scholarship, like the Queen Elizabeth Commonwealth Scholarship, the Jamaica Commonwealth Scholarship. You could go there, spend a year or two and transition to the United States, right? For example, or to Canada or anything. So people don't keep an eye on this place. I want to encourage you. The scholarship may be closed, but we need to put this information out there so that you can plan ahead when it comes out. People don't really look at that direction, so please look into it. And when you want to come to the United States, of course, there are lots. In fact, the health sciences is very funded, well funded in the United States. Masters of Public Health, PhD in Public Health. So according to your career goals, you might do a master's or PhD, whatever it is. And in the US right now, because of COVID, before most public health programs, they are very heavy on the quantitative aspect. So they always require GRE. But right now, most schools are waiving it. So it might be an opportunity for you to take advantage of this waiver during this period, because if things return to normal, some of them might go back to, the previous manner, and they go back to requiring GRE. So you want to take advantage of that. So, but right now that they are not requiring GRE, so the best way for you to prove that you have quantitative skills is, one, you want to highlight those mathematics courses you've taken at bachelor's or master's level. If you've gotten really good great scores, you let them know. If you have skills in computing and programming, you want to let them know. And that's why I encourage people to take MOOCs, online courses, right? To show, if you have portfolio where you've done some good things with statisticals to show it. Because when GRE is not there, how would they evaluate if you have the quantitative skills? Is, by these things. One, your transcript, online course works, and you use some really nice quantitative tools. I think that's one of the best ways. That's one of the important skills you need to get into public health. Well, it also depends on the area of public health which you are going to, but we might agree that a lot of areas in public health are focused on quantitative aspects, right? So even though you are doing some qualitative work, you will still need to present your data in a coherent manner, like Dr. Odu always say. So it's very important that you take advantage of that skill. So like I said, the Caribbean, keep an eye on it. The United States, very, very funded. If you want to stay in mainland Europe, there are also programs that fund public health. In a program in a scholarship that funded me, for example, to the masters in France and Germany, the Erasmus, and they have some public health programs too. So you want to look at infectious disease and One Health. You want to look at European Masters in Public Health, and I think the third one is Public Health in Disasters, right? So this is a very interesting program. Like we hear the word Public Health in Disasters. I knew someone who got into this program. I think they did public health from Nigeria, but they had some really interesting volunteering experiences in the northeastern part of Nigeria. I looked at the lady's profile, looked at her SOP that got into this program, and she did some things about vulnerable children, internally displaced person, and this is the area where volunteering also plays a role in getting scholarship opportunities in the field of public health. I know Dr. Iran of Australia will agree with me. He had some really, really, volunteering experiences. You can go check his website as well. Public speaking experiences in the area of, health, community health, all those things. So please take volunteering experiences very serious when it comes to public health. I think it also plays a role. Volunteering, quantitative skills, and you are good to go. I wish everyone the best.
Thank you. Yes, absolutely. I think we have touched a bit on volunteering, and I don't think we can exhaust that part. I don't know. I see people say, where do I volunteer? I don't know. I'm in Nigeria. I'm like, with all the NGOs in Nigeria for public health, like how? That's like, here is even more, is even more restrictive where you can go, because most of these places are government agency that are in public health, and so they sort of like have some a bit more rules before they take you up. But NGOs in Nigeria are like scattered everywhere, that you just go and volunteer once or twice in a week and get your experience and go and get your funding. So please take that very seriously. Aaron, I think it's Aaron, or is it, I'm not sure who's.
Aaron.
Okay.
Thank you. Abraham mentioned something when he was speaking, and it just resonated with me with what I posted yesterday on my social. So, I mean, you might be here and you'll be thinking, he mentioned something around leveraging people around you, not necessarily waiting for people who so-called scholars to review your essays and SOPs and all of that. Yes, some experiences. We come with some experience because of the path we've been through, and that's how we're able to give